Franklin County Board of County Commissioners is now in session for this Tuesday, January 17th, 2023 regular meeting. We're going to start this morning with the invocation and pledge of allegiance. If you would please stand. Our Father, we thank you today for your hand upon our lives. We thank you for the opportunity that is ours, the responsibility that we bear, and the ability, God, to make good and prudent decisions, not just for today, but for every day you give us and the residents of this county. Father, be with us today in our decision-making and understanding. We thank you for clarity in Jesus' name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. First order of business this morning is a motion to approve the minutes and the county bill list.
So moved.
We have a motion to approve by Commissioner Ward,
Second.
second by Commissioner Sanders. Any discussion? All in favor?
Aye.
All opposed? That is a unanimous vote, 5-0. Okay, now we're at public comments. I'll just take them in the order I have them. Daniel Jackson. Is there Daniel Jackson in the room, or are they on Zoom, Michael?
No, they're not.
Oh, no, never mind. That's for later in the meeting. My bad. That's
Well,
not for now.
Yeah.
That's when we're discussing a particular subject. Nanda Ming. Good morning.
Good
ma'am.
morning, Commissioners. It's a beautiful Tuesday. My name is Nanda Ming, Alligator Point. I have 3 points I would like to bring to y'all's attention. Number one, there's a speed limit sign in the area of 1497 on Alligator Drive that is overgrown with palms that you can't even see the sign. So maybe if we could get somebody to come out and cut it. I don't want to do it because it's public property, but it might help with our speeders. Number two, the sidewalks on both sides of Tom Roberts Road are overgrown and are not walkable. They have these big sticky pines and stuff on it that you don't want to touch. If we can maybe get somebody out to help us clean that up, that would be awesome because we are walking in the street. And then the third one, we love the new road, but our fellow friends, quote, are now parking on it illegally. And my suggestion is, can we paint on the sidewalk, no parking, and then maybe some stripes so that they can now see that a visual that it is not a parking spot on the road. I'm not talking on both sides, I'm talking on the ocean side, where the road is flat like this and then it veers in a deep V and they're parking on that slant. So I don't want to see anybody fall into the ocean, but that would be a suggestion that I would have. And also on that area, that same area, it's really dark because there's no streetlights on that road. Can we maybe add reflectors on the actual pavement to see if, to help with us? Because being my husband's part of the fire department, we don't want to get a phone call in the middle of the night where somebody runs off the road. So just some ideas. Appreciate your time. Thank you.
Thank you, Mom.
Thank you.
Mr. Rudy Ming, you're next, sir. Just go forward, state your name for the record. You have 3 minutes.
Good morning, Commissioners.
Morning.
Lovely day at Alligator Point, like my wife said, my better half. Just addressing parking as it gets ready to heat up on Alligator Point again. The parking aspect, we really don't have a plan again going into this year. It seems like, as some of you have said, we keep procrastinating. In October, we put it off, and then it heats up again in March for the spring breakers. As we move forward again, need police presence for that, and tow company, and then maybe that sign that gets put up every year. I think all of those items will help with reducing the madness of parking on Alligator Point. That's all I had for you. Thank you, Commissioners. Appreciate your time.
Thank you.
Thank you.
All right, and Michael, that other one was for later in the meeting, so I'll try to remember it.
Yeah, I'm not sure that even comes up today, but because the public hearing is until next month.
Yeah, no, it's not.
So I
It's
thought
not.
maybe he had a comment about it, but, so I'll get in touch with him and find out what's going on.
Yep, okay. All right, and you said that Mr. Kozar was running a little bit behind, correct?
Running a few minutes late, I
Okay,
believe. so
we'll start with Mr. Richard Lewis then.
Good morning, Commissioners. I'm David Walker, CEO of George E. Williams Memorial Hospital, and I have Richard Lewis here with me. We have an action item request for you all. Initially, probably not last fiscal year, we were going to come to the County Commission to purchase one EMS vehicle for $342,000. And then a couple of weeks ago, Mr. Morone notified us of a grant that we can apply for that will pay for 75% of an EMS vehicle, and we pay for 25%. So we decided to do two EMS vehicles instead of one. And so the total cost for two EMS vehicles is $684,874. USDA would pay $513,700 if we receive the grant, and we will have to pay $171,174. So we're getting the price of two vehicles for the cost below one purchase price of one. So our request this morning is that you approve and allow us to purchase the EMS vehicle and use the $171,174 out of the capital outlay funding for that vehicle, for those two vehicles.
Mr. Walker, have we already received a notice that we're going to be awarded the grant funding? Where are we at with that?
No, we haven't. We just submitted the grant.
Okay.
So it's a possibility, that we will get the grant funding. But if not, then we'll just have to request that one vehicle right now. Okay. That's 342.
So what you're asking this morning is a motion by this board contingent on receiving that grant funding to use money from the capital outlay to
Purchase.
finish the grant off.
Yes.
Basically.
Yeah, the 25% EMS.
Okay.
Yes.
Just wanted to clarify.
Okay. Thank you.
So move on that condition.
All right, we have a motion to approve by Commissioner Lockley,
Second.
second by Commissioner Sanders. And again, what we're voting for here, I think what the motion is that we are agreeing to encumber potentially 25% of the total funds for these two ambulances based on receiving this grant.
Yes, based on that. Yeah.
And if you do not receive the grant, you have to come back.
Yeah. If we do not receive the grant, we'll come back for asking for a request for one ambulance at 342.
And one further question, if I may, do you have any idea the deadline for the grant or when you might potentially know?
Yeah, well, we sent these particular funds for USDA, as soon as you get the money in, because it's highly competitive, so our grant was submitted,
Right.
so we may have a 2 or 3 month window.
Okay.
They'll let us know, at least they'll tell us, and then the official statement may come out a little later, but at least we'll know that.
Okay,
Yeah, we've got other grants from them as well.
yes, sir. Any more discussion, Commissioner?
Yes,
Yeah.
Mr. Chairman, Mr. Lewis, how old your ambulance, the fleet that you currently have, what's the year of the oldest ambulance unit you have?
2015,
And how many miles does that have on it?
300,000.
Okay. And how many total do you have in your fleet right now?
We have 5 ambulances.
And they're all in working order?
Yes, all of them runs. Our maintenance cost is pretty high right now due to all the miles we have on them.
Okay, I just wanted to make a note for that for the record, for the public to be aware that we're due some ambulances apparently.
Yeah.
Well, and it also is gonna take a while to get them. Go ahead, Commissioner Lockley.
We done got this ambulance before on the 75-25 match,
Yeah.
and a lot of times it just take time for it to be processed. We've done it before, and it's a good thing if we can get 2 for 1. Pretty good.
Mr. Chairman,
Yes.
being back on here kinda new, I thought that the Department of Health still did the baby grants for the radios and the communication, but they don't. I talked to Louis,
haven't gotten those
and
in a
they
long
don't.
time.
Now, that would be the good one, cause it's 80-20, I think it was
Yeah.
80-20. But, anyway, if we can get 2 ambulances, that's very good.
Mr. Chairman, I got one more question.
Yes.
This, Mr. Lewis, this, I think you said 684 for 2. So 300 for one. Now, is this completely outfitted with the radios and all your medical equipment? Your
So yeah, when we
defibrillators and
order an
such?
ambulance, we have the power load system and the stretcher, which what that does is it lifts the patient up into the ambulance. We'll have the radios that's built into the ambulance, as well as 2 handhelds and a built-in internet system.
So there's no additional cost. This is all included
Yes.
in this price?
Yes.
Okay, thank you.
Mr. Chairman,
Yes.
so what we'll do is whatever they take out of fleet, that's 2015 and anything else he does, that we put up an auction, and then the money from that auction goes back into the capital side of the taxes.
Okay.
Just that you know, that's what happens with the older ones, that they take out of service.
They're gonna use the box, right? Or the box come with the feed?
The box comes with a new one.
Yeah.
Oh, okay.
And there's usually, just to make sure, since we are discussing it, after you know that you're gonna get them and you order them, how long does it usually take to actually receive them?
So we ordered an ambulance back in 2021. We are going to receive that next month. So it could take anywhere from 8 months to a year and a half.
Right. Okay. Well, I'm sure that was slowed down a little bit by COVID, but it
Yes.
still takes a minute.
Yes,
That's-
sir.
I just want to make sure everybody was aware of that. All right, any more discussion before we vote? All in favor? Aye. All opposed? That's unanimous. Anything else, sir?
Yeah, I just want to add, can I have the hospital board members stand? We have some of our hospital board members here. They're like volunteers, you know, they volunteer their time and effort on the board. And I just want to just public recognize them. Thank you.
Thank y'all for what you do.
No, we're still waiting on Mr. Kozar, right?
Yes.
So I guess we'll just go down our agenda to Miss Betsy Mansfield from FSU Coastal Marine Lab. Good morning, Miss Betsy.
Good morning, Commissioners. Thank you for your time and Happy New Year. I hope y'all had a good holiday season.
Yes.
My name is Betsy Mansfield. I'm a researcher based out of Florida State University's Coastal and Marine Lab. And my work at the Marine Lab is focused currently on recording experiences and knowledge held within the Apalachicola Bay community and about the oyster fishery through conducting one-on-one confidential interviews. I'm working to record the experiences of many different community members within the region to document understanding of the history of the oyster fishery, how the bay and the county has changed since the decline of the fishery and its closure, and determine how groups among the community would define success for the restoration efforts occurring within the bay. The goal of my work is to capture the deep knowledge that's held within this community about the oysters and the bay as a whole. And I hope that my work will inform local decision makers, such as FWC, and also provide social context for other scientists working in the bay. I hope this information will provide a comprehensive set of perspectives from community members within the region, including what the community sees as important for the restoration of the bay, and will provide community knowledge that can improve management, restoration, and research decisions. I'm hoping to interview a wide number of community members, including previous oyster fishers, commercial fishers of other species, fishing guides, tourism groups, seafood buyers, and community leaders, including all of you if you have time and interest at some point in your, I know, very busy schedules. I'm speaking with you today merely to just introduce myself and my work, and ask that you keep me in mind when you are speaking with your constituents. I've provided a handout with my name, email, and phone number that you are welcome to give out to anyone you think might be interested in speaking with me about this important topic. I'm really dedicated to ensuring that community members feel that their concerns and experiences are being recorded and heard. And I'm also following FSU research protocols, which means the information I gather from these interviews remains confidential and anonymized. If you have any questions at this time, I welcome them, and I really hope to speak with you all in the near future.
Anyone have any questions for Ms. Mansfield?
Yes, go ahead.
I would just say, thank you, Mr. Chairman.
You're welcome.
Make sure that you get with our local oystermen, with the seafood watermen people. They have a lot of knowledge, it's not all scientific. So my thing is, if we get the knowledge from the local folks that does this, you'll be one up on everybody, because nobody wants to listen to them sometimes, or they feel like that. So if you would do that, that would be a good thing. And what the oyster fishery needs, nobody's ever really told us what it needs. So if you find that out, you're gonna be doing pretty good.
I've been trying to reach out to local community leaders and folks and that I have connections with and things like that, which is why I'm coming to you today as well and speaking publicly to kind of just introduce myself and say, if you'd like to chat with me, and anyone in the audience as well, please feel free to come find me or reach out.
But please get with the local
Yes, I
people that
definitely-
work that bay, that knows that bay, that
Yes.
needs to be listened to.
Yeah.
Commissioner Lockley?
Yes, I guess my thing is, a lot of the problem is, a lot of our people, they out of work, but there's no communication. If you would you come in every now and then and update us? Or like you said, I'd rather for you to update the people, because they ask us when we go in the grocery store, church, anywhere we go, when the bay gonna move. I doing that. And I feel bad when I can say, I don't know. And if I don't, but that's not a good answer to get nobody when they're out of work. So if you will, just communicate with us so we can communicate with the people, because they not going to Tallahassee and ask them folks. They gonna act on the local level.
Yes, I completely understand. And while I'm relatively new, I do know that I have connections with both other researchers at Florida State as well as FWC folks, and so I'll also communicate that to them to make sure that they are also continually in communication. I'm happy to provide any information that I can have, but also I know that folks from FWC have more of that decision-making information that they're kind of the head honchos on that front.
Thank you, ma'am.
Mr. Chairman.
Yes, sir.
Dr. Mansfield.
Yes.
We've talked.
Yes.
Just to be clear, you're not directly working with ABC, FWC. You're doing your own research. This is something separate, right?
Yes, I'm not on the ABC CAB group or anything like that. I attend the meetings, so I know what's going on. I work at Florida State, so I am informed on the research that's happening in ABC and things like that. I talk with FWC members to understand what's happening in the Bay so that I can be informed if community members ask me questions about what's going on, or I can contact folks to say, hey, somebody I was talking with asked me about this. What's the answer that I can relay back to them? But this is kind of a separate piece that I'm hoping will provide context and information to those groups that are working there, and provide more social context.
The reason I want to make that clear is that your castle isn't the one we want to storm, so to speak. So what you're trying to do is get, and I've told some folks this, she's not the one we want to be combative, so to speak, with or hold our ground. You're more so looking for information, historical information, impact it's had, things that's happened in the past. So I just wanted to make sure that was clear. So if anybody's out there listening, the public knows that we have an ear here that we can lean on, so to speak, and that information can get out, because like we've discussed before, a lot of people, if you say FSU, they're gonna shut the door.
Yes.
But just for clarity, you're not directly associated with any of the other ones. This is research on your own from a different department. Just out of curiosity, the funding, is it from the same funding,
No,
or is it separate?
the funding comes from the Office of Research. So it's a larger on-campus department. So none of my money comes from like the Triumph grant or anything like that.
Okay, thanks. I just wanted to make sure we made that clear. That way, going forward, people won't be hesitant to come out and speak with you, okay?
Yes,
All right,
thank
thanks.
you.
Mr. Chairman, that's the reason why I brought up, the best thing for her to do is talk to the local fishermen. Because it seems when you talk to the local fishermen, that nobody else has talked to them. So that's what I said. They need someone that they can tell their story to, because they have a lot of institutional knowledge. They went out there and worked it. And if you found somebody with FWC that knows the answers, please tell us. Because I caught that what she said just a while ago, because every time I've tried to talk to them, they don't know the answer. They're still trying to find the answer. So, anyway, that's the reason why I brought it up like I did.
And also, just, I know I've gave her some contact names. If any of y'all have anybody that you know that could be,
Yeah.
you know, I'm trying to pick the ones that's not going to chew her head off, so to speak.
Oh, yeah.
But you know, that'll you know, once that word of mouth gets out, hey, you know, Dr. Mansfield, she's not a part of the
Other stuff.
Yeah, so it'll start trickling around,
Yes.
and people will open up a little more. 'Cause
Yeah,
we are a little standoffish community at times with locals. I mean,
I completely understand, and I know that
Subject matter.
folks are out of work and there's frustration surrounding it. So
there's a trust issue.
I
Yeah.
I
and that's
understand.
been a problem.
Yeah. So the number and email that I gave, you feel free to please give it out to anyone that you think would be interested, or also feel free to pass numbers and names along directly to me, and I can reach out and say, Commissioner Jones gave me your name, and if you're interested, please speak with me. If not, I totally understand. So
I do appreciate what Commissioner Amison asked to bring some clarification. And I will say, not to make a long story, I'm going to make it shorter than what it would be. I had a conversation probably a year and a half or so ago, maybe 2 years ago now, right before the bay was closed. There was a gentleman just happened to be at a local eating establishment eating. I went in there for lunch. He's talking with some of the people that work there, and this is not being derogatory. You'll see where I'm going when I get to the end of it. He's a marine biologist talking about studying the bay and different stuff they're doing in the bay. And he kept going on for a while, and I said, can I ask a question? Can I butt into y'all's conversation? You know, I'm not trying to be rude, but can I ask? And he said, yeah. I said, can you, since we're talking about science, we're talking about the scientific method, can you please describe to me what tank you're creating that changes its conditions every hour like the Apalachicola Bay does? How, you know, if we're talking about scientific, we're talking about research, where are you using that its conditions changes like our bay does, sometimes hourly? And he didn't have an answer for that. So the reason I'm saying that is saying this. Yes, there is a lack of trust, but I think it stems from the fact that nobody has ever, before hearing you today, nobody's ever wanted to hear what the local people actually had to say. And I think it is scientific what they can tell you, because they've been doing the same thing for days, weeks, months, years. And if anybody knows that bay, they know that bay. They know that there are times that it's just not going to be good, but that's not the end of the world. That bay very much is like cotton farms up in Georgia. Some years just aren't good. It's just the way it is. But they know the steps to take, those that have been there and have the institutional knowledge of it. So it might not be considered the scientific method, but I think it is scientific because they've repeated the same process many times over. And I think you'll find that if you get a chance to talk to some of them.
Yeah.
And I think it's going to be beneficial for everyone involved.
yeah, and I recognize the immense value of the local knowledge that's held within this community. So that's where I'm really trying to, you know, there are folks that have been out on the water every single day longer than I've been alive, so I know that they have a wealth of knowledge that I couldn't possibly begin to imagine.
Well, hopefully
So-
we're going to get you some of it.
Well, thank you so much.
Yeah.
Thank you.
Any other questions for Dr. Mansfield? Thank you.
Just one more comment.
Yep.
Yes,
Real quick. When you get through with this study, I'd like to see what you find out.
absolutely. Yeah, I can provide, everything will be anonymized, so it'll be grouped together by responses of common responses based on previous jobs or location of living or number of generations in their family. I can present it in a variety of different ways, but I will provide the commission with a report of what I find. I'm here for a while, so it might not be until 6, 8, 10 months down the line, but I'm trying to get to as many folks as possible. So
Thank you
Yep.
very much.
thank you for your time.
Mhm. Mr. Brown, you having technical difficulties? Okay. Michael Kozar, Alliant President, for an update.
Yes, thank you for allowing me to be here this morning, and I do apologize for being a little bit late. Had some mix-up with my alarm clock this morning, switching from Eastern to
That'll get you.
Central, and it got me this morning. I'm sitting at the hotel thinking, oh, I have about an hour, and I realized that I didn't, so I do apologize for that. But again, I wanted to come in and give you an update. I know Jim Coleman, the former president of Alliant, came about a year ago, and I wanted to express, our appreciation for working with the hospital, Weems Hospital here, and how much we value the relationship. And I wanted to just give you a short update on some of the things that are happening and some of the things that we've accomplished in the past year. And again, I have a slide presentation here, and I want to, again, thank you all for the support. Equipping Weems Memorial Hospital with continue to meet the needs of the community now and into the future. Alliant is committed to work to the right solutions to fit the community needs. I'm sorry, I did something here, Michael.
He's at the bottom of the presentation, Michael.
Yeah.
That's what it looks like.
I'm sorry. No, you're good. Just click this presentation, and use your arrows to.
Okay, I was using the wrong arrows.
We're good?
Nope. No, it's skipping to the last one. Okay. Our goal as Alliant is to help rural hospitals identify and achieve sustainable business models. This map just shows you where Alliant has a presence in the country. The blue dots are the managed affiliates, hospitals that we work with and actually manage. The gold indications are where we have our purchasing arrangements with them. Some of the significant accomplishments this year is we converted the electronic health record from Athena Health to CPSI Evident, for example, for the patient billing, and supported by TruBridge. So that was a big undertaking. As anybody knows, the conversion of any electronic health record is a complicated task, and that was a significant accomplishment this year. Again, the Carabel retail pharmacy study, we developed a performa, prepared and workshop held with the county commissioners on that. The 340B drug pricing program, we engaged and promoted compliance and optimization of the 340B program. The 340B program is a pharmacy program that provides significant discounts and compensation to the hospital for drugs that are purchased through pharmacies that is come back to the hospital in forms of financial compensation. We're providing the interim financial services. We're working with the local controller while we continue to recruit for a permanent CFO at the organization. We're also utilizing, some assistance from Northwest Florida Community Hospital in Chipley to provide some added support to the facility also. We completed the Medicare cost report, the Florida Hospital Uniform Reporting Systems, and the Florida DHS disproportionate share survey, and we completed those in a timely and required financial reporting for the regulatory requirements. Each month, we hold what we call as a monthly hospital operation review. We focus on growth, utilization, financial performance, and clinical quality outcomes. We also have numerous calls throughout the month with various leaders in the organization to be able to provide guidance and support to the operations of the organization. We conducted a board education leadership development. Annually, Alliant holds a conference for board members to provide them with the latest information on governance and regulations that are affecting the healthcare industry, and also talk about the challenges and the opportunities in today's healthcare environment. It also gives our trustees the ability to network with various other trustees throughout the Alliant network to learn what's working for them, what's successful, what are the things that are challenging them as we move on. We also complete an annual salary survey. We conduct a survey amongst all our facilities to ensure that our staff and our employees are being compensated in a fair and what is the going market for those positions throughout the organization. It helps us stay competitive in the market as far as our salaries are concerned, and make sure that we're balancing that aspect. And as we all know, one of the challenges coming out of COVID has been the escalating salaries that are happening in the healthcare environment. Salaries are increasing tremendously. In many organizations had to revert to agency or travel nurses to help staff. So making sure that we're competitive to be able to attract the right talent to our organization, to be able to handle the patients that we need to do, and to make sure we have adequate staff is critical for the organization. The rural health clinic support. The local Alliant Hospital Director of Clinical Operations provided on-site guidance and provided the best practices. Paula Moore, our clinical director, works with the rural health clinic to ensure that they're meeting the regulations and requirements of the rural health clinic, but also looking at best practices, what is working at other organizations that we can take and bring to our organization. One of the things that was just initiated that we really feel is going to be strongly enhance the overall organization and the volume of patients that utilize Williams Memorial Hospital is the care coordination services. And this is where we have many times seen patients being transferred to, and I'll use TMH as an example. Many times we have patients that are transferred from here to Tallahassee for a higher level of care. The challenge is getting those patients back to Franklin County to be able to care for them here locally. And the development of the care coordination services is going to be able to make sure that those patients are referred back either for services once that higher level of care is no longer required, as at, for example, TMH, so that they can be cared locally. But also, more importantly, the hospital has a swing bed program, and it's an inpatient rehab which allows patients to strengthen and to recover from extended illnesses, injuries, or surgeries. What we have found is a lot of times these patients, once they were transferred to Tallahassee Memorial, were being kept in Tallahassee at companies like Encompass, Pruitt Health, for their rehabilitation. Those services can be provided right here in Apalachicola at the hospital. So the development of a care coordinator services enables us to track those patients to make sure that they're being brought. I'll use an example that happened just on Friday. The care coordinator was in Tallahassee meeting with the case managers there at Tallahassee Memorial. There was a patient from Taylor County, and of course we operate the hospital over there in Perry, Florida. And that patient was scheduled to be discharged that day to Encompass Health in Tallahassee, but they lived in Perry. Our care coordinator was able to talk with the family. That family did not even know that those services were available locally, and was able to get that patient transferred back to their community, back close to home, to be able to get that extensive rehabilitation services. So we have instituted this, and I think it's going to greatly enhance the ability for our patients to come back to Apalachicola, receive that rehabilitative care here locally, which also helps our facility by being able to provide those services. So we're excited about the development of this to ensure that we're getting patients back to our hospital to be able to care for them locally. We also embarked on a marketing communication specialist, and this ties to just the statement that I was just making on the family's lack of knowledge of what services were being available to them. So the three hospitals, Calhoun Liberty Hospital, Doctors Memorial Hospital, and Weems Memorial Hospital have come together and coalesced and are acquiring a marketing specialist that will market these facilities. It helps spread the costs over the three organizations, so each organization is not embarking on a marketing person for their organization, sharing the cost of that individual. That individual will be also stationed at Tallahassee Memorial so that they have the ability to access all the services, all the information that TMH has, but will be able to tailor specific marketing plans for each hospital so that what the needs of Weems Memorial Hospital is not the same needs as far as marketing as a Calhoun Liberty or a Doctors Memorial in Perry, but they will tailor those needs and services and market those specifically for that location. But it affords the organization to have a higher expertise marketing individual with a fraction of the cost of being able to bring somebody on themselves. Alliant Purchasing, one of the advantages of being a part of Alliant Management Services is our purchasing group. And last year alone, the hospital realized over $54,000 worth of savings from purchasing supplies and equipment through the Alliant Purchasing, and that's direct savings back to the hospital. We're investigating what is called an intensive outpatient program and developing a multidisciplinary treatment team that treats senior adults with diagnoses such as major depression disorder and generalized anxiety disorder. And this is sometimes referred to as a outpatient geriatric psych program, but it helps citizens in our community that are struggling with depression. And many times, our senior citizens, may have a loss of a spouse, may have a traumatic situation that happens, and this gives them an avenue to be able to seek help, counseling for these types of issues that they're facing. One of the advantages of us being a critical access hospital is that all the expense for this program is allowable on our cost report, which then we actually get reimbursed based upon our costs. So it actually helps improve our reimbursement that we receive from the federal government in taking care of these individuals on an outpatient basis. We're also developing a assistance with the local human resource leadership here to share some of her expertise with some of the other Alliant facilities to be able to assist them. We're fortunate to have a very strong HR manager here at Williams Memorial Hospital, and tapping into some of her expertise to help other organizations. Some of the strategic initiatives that are underway. This spring, we'll be embarking on a strategic plan with the board. And it's really a roadmap to the strategic initiatives moving towards a shared vision of the organization. And our typical process includes key stakeholder interviews, market assessment. We'll take a look at the market, what percentage of the market are we capturing, what are we losing, and what services are people leaving our community for, and does it make sense to bring those services here locally to be able to keep patients close to home. And again, the success of any rural hospital is to be able to keep those patients and treat for those patients close to home. We'll look at a physician needs assessment. What physician needs are in the community? What areas? Is it primary care? Is it surgery? Is it internal medicine? Is it pediatrics? What are the services that the community needs? And how we determine that is basically we look at what the out-migration is. What are people leaving the community for, and what are those services? And does it make financial and business sense to bring those services close to home? We'll look at the quality analysis. What are the challenges, or what are the successes that we're having in delivering quality care to our patients? We'll have a planning session with the leadership team, and ultimately conclude with a planning retreat with the board. So this is a major undertaking for us this year as far as developing the strategic direction of the organization. Also, as has been discussed many times, to obtain and update architectural feasibility study on the organization and what are the needs of the organization and moving forward. And the goal is to facilitate increased demand and improve and upgrade the condition of the current facility, a need to stimulate the economy, and a desire for the county's residents and their families to receive quality patient care, centered care in a modern setting with private rooms. Williams Memorial Hospital should undertake a capital construction and renovation program. I know I ran through that fairly quickly, but I want to again thank you all for the support that you give Williams Memorial Hospital to continue to meet the needs of the community now and into the future. And we as the Alliant are committed to work towards the right solutions to fit the organization's needs. And I'd be happy to answer any questions that you have.
Anyone have any questions?
I got one.
Yes, sir. Go ahead, Commissioner Lockley.
I guess my question would be, is y'all collecting enough money for y'all to pay yourself?
I'm sorry, could you say that again?
What I'm asking, is y'all collecting enough money for y'all paying yourself, right?
Right, correct.
I mean, you understand what I'm asking?
Yes, and one of the things that I checked on my way over, just to make sure, you know, the hospital is in a break-even position right now financially for the organization. I think some of the initiatives that we're working on is going to continue to strengthen the financial position of the organization. And as I mentioned, even just with the care coordination services, and I'll just give you an example, and I don't have the exact numbers for Williams Memorial Hospital, but I took a look at, you know, this care coordination services and what it means not only for the quality of care for the patient and keeping them home, but the financial impact of that. For example, there was 5 patients that were transferred back to facilities. 2 of them were for acute admissions, and that would be that they required an acute stay at the hospital post their stay at Tallahassee Memorial, and 3 were for swing bed. The total charges for those patients, if we were able to capture all 5 of those patients, for example, here at Weems, would have been $87,000 worth of revenue generated by the organization. So when I talk about us improving the overall financial condition of the organization, it's programs like these that are going to continue to bring revenue to the organization. Again, as I mentioned, the intensive outpatient program, those costs are fully 100% allowable on a cost report. What that means to the organization is that our reimbursement for every patient we take care of, every Medicare patient we take care of, will increase because our costs increased. And so Medicare says, as your costs increase, we need to pay you more. So that helps us in increasing our reimbursements for the organization. So Commissioner Luckey, I hope I answered your question.
Yeah, I'm satisfied. As long as y'all paying yourself, keep on doing what you're doing.
Right. Yeah, we're very excited about where the direction of the organization is going. I think the plans for moving forward with the emergency room and those aspects of it is going to, again, enhance our image in the community, confidence of the community in the organization, and it will continue to help us build our organization into a strong financial organization.
Yeah, I just wanted to, the reason I asked that was mostly for the public.
Sure. I understand.
Yeah, I'm glad. I'm fine with it.
Sure.
Any other questions, commissioners? Oh, go ahead, Mr. Davis.
David Walker, 2 things I know Mike probably didn't mention. One of the things about the cost report, the cost as a critical access hospital, we get to claim expenses, maybe 40%, half of our expenses back to us. Meaning that if a client costs me $10, at a cost report, I can claim at least, $6 back. Is that kind of correct? Yeah. And so that's one of the advantages of a critical access hospital. Secondly, one of the things, I don't know if we mentioned it last year or this year, with Alliance Health, for the first time in years, we were able to offer our employees retirement benefits. That's something that the employees didn't have before. Now, it may not help the ones that have been there like 30, 40 years right now, because they're, I may have to say for that, but any employees that are starting now, we are able to offer those employees retirement benefits, and I think we're probably finishing up our year with that now. So I just want to just add that on there.
Mr. Chairman, hold up, David. Hold up right there, and you too, Mr. Mike. Louis, come on up here. Earlier, we said we were thinking about, they asked us to support the purchase of 2 ambulances, at least 1, hopefully. I'm not gonna try to put y'all on the spot, but I wanna know. Mr. Noah wants to make sure y'all are getting paid plenty of money, okay? Making sure that we're making a profit or whatever. I wanna know, Louis, do we have enough paramedics and EMTs on the ambulances, and with the with the idea that we're gonna have maybe another one, at least one, maybe two online? Or we, gonna be having enough employees to man those ambulances? And two, with dealing with the state ratio of what paramedics and EMTs, where does Waynes Memorial Hospital sit?
So as of right now, we are short on paramedics and EMTs. There is a nationwide shortage. Since COVID hit, a lot of paramedics and EMTs are actually getting out of the business. We are pretty much on par with Wakulla County, Gadsden, Jefferson as far as our staffing goes. When we get the new ambulances, they'll be replacing old ambulances, so we won't be adding additional personnel. We are working on recruiting. I have 5 individuals here in the county that is going to go to EMT school, that we have a grant to send them, and I'm hoping 1 or 2 of them will go to paramedic school. So we do have plans to try to start bringing more employees from Franklin County into the service.
Okay, now, Dave?
Yeah, let me just add, what Lord is saying also, one of the things, you know, we have to look at too, the rising costs of EMS. You know, the state had a mandate, you know, the minimum wage mandate, everybody had to come to that. And so that kind of, you know, we had to increase salaries throughout the whole organization, but the majority of salaries were increasing through EMS. And that's something that the state, you know, they didn't give us any money for that. You know, they're counting on the managed care plans to increase our rates like they will, you know, and to cover that shortfall. And so I think, you know, the rising cost of EMS, operating EMS, you know, we may begin to see that, you know, in the future. But that's something Laura and I will take a look at that, and, you know, at the next county budget workshop, you know, we may have some more numbers, you know, what EMS is costing, and, you know, with all those mandates coming out from the state.
Is the pay about across the board? Is it about even with Waynes and across the state, or is there something that needs to be done? I'm just bringing this to light.
It's fairly close to the region. If you go down to South Florida, the pay is quite a bit more, but as far as the region, we're close to being in line with what other services are doing.
Okay. The reason why I bring this to light is I want everybody to understand that although not maybe all of our citizens uses the hospital or the clinics, all our citizens that need emergency medical services uses the emergency medical services. And we don't need to leave them out of the loop. We need to make sure that that's done. I'm going to go a little bit farther. In the past 4 years, I've had the opportunity, sad to say, but I did, to have to use the Waynes Memorial Hospital. And I say it's sad because I eventually lost my husband. But the thing about it is every time we used that hospital with his medical needs, he was well taken care of. And he didn't want to go nowhere else. He wanted to stay in Appalachia. And so that is a testament to what the hospital stands for. If we could build it and grow it to where we could stand on our own 2 feet, and I think everybody would understand, and not have to have TMH, Sacred Heart, or any of these, but just get a company to manage our hospital and let our local folks be able to stay home with that higher level of care here instead of having to send them somewhere else. We would be a lot better off.
Yeah.
Because no matter whether you go in the building and it's got dingy walls or dirty floors or, you know, everybody's saying everything, you cannot surpass the heart of the people that work in that hospital.
I agree with you, you know, Commissioner Sanders, and this is what we're seeing for people that come back to the hospital, because the people there, we know those people as well. You know, I had a personal experience, a family member that had to have higher level of care, you know, outside of Franklin County, and it's the wear and tear on the family. You know, my father-in-law wound up dying, but it's just the wear and tear, going to Tallahassee, sleeping over, going to Panama City, and then you have to fight sometimes with these regional hospitals to get our people back here, because sometimes they say, oh, Weems don't take care of them. Oh, no, yes, they do. You know, we can take care of them. I'm a firm believer that, you know, we should take care of our own people in our own county, and we should have the best facilities to do it, you know, here. And so, you know, my heart is touched when we talk about personal stories, because we all live in this community. You know, we have people that we know personally, you know, that use the services. Now, I'm not saying that we're there yet, it takes a while to get where you want to get, but we still can make, improvements every step of the way. But I'm a big proponent of taking care of our own here in Franklin County. Just last week, I had to travel to Tallahassee with my wife, some appointments up there, and that's some of the things that we can do here. So these are things that, we live in this community. We make that 2-hour ride and then become a 4 or 5 hour day for as many of us. But as many services that we can put in the community, that's what we want to do, increase access to care. And I think the partnership that we have with Alliant, that is allowing us to do that. Like I said, we're not where we want to be, we're not where we used to be, but I think we're making the right decisions to try to keep patient care local here. And when you think about the hospital, you got to think about 4 things. Your hospital inpatient, hospital emergency department, EMS, and our clinics. That's the stool. So when we talk about the hospital, we talk about our clinics, EMS, and our inpatient and ED components, as well as our outpatient services as well. Thank you.
Chairman, I got a question. This is for Mr. Kozar.
Sure.
You were referring earlier about shared cost, a program with shared cost between, I guess, Weems. What was the three?
Doctors Memorial and
Doctors Memorial. Where is that at?
It's in Perry, Florida.
Okay, that's Perry. Okay.
And Calhoun, Liberty, and Bluntstown.
All right. How is that broke down as far as the percentage of who's, you're getting 50% from Franklin or Weems, 25%, vice versa? I mean, how was that cost breakdown?
It's broken down evenly between the 3 facilities. So
Okay.
each facility is sharing equally in the cost of that position, and it enables, again, for us to be able to. And I'm just going to use, I don't have the exact numbers of the salary of the person, but I'm just using this as an example. Say the position is a $75,000 position. Each hospital would contribute $25,000 towards that position to be able to do that. We wouldn't be able to find a quality marketing individual with experience and knowledge for $25,000. And again, I'm just using those numbers as an example.
Okay. My other question, salary comparisons, kind of going back. When you've obviously done a salary comparison, where are we at as far as like your RN, your actual medical staff, on a regional comparison? Where are we at?
We are competitive, what we call competitive. There may be some positions that there may be a little bit higher or a little bit lower, but when you look at across the board, we are competitive. And I know the hospital embarked just recently, and David mentioned this, on the $15 an hour mandate that came down from the state, which basically stated that if you receive Medicaid funds through the state, that any caregiver that works for your organization had to be paid at least a minimum of $15 an hour. So what that did was it caused some what we call compression, by moving the individuals up that may have been lower than the $15 an hour, moving them up to what that means is you had to adjust other salaries to be able to stay competitive in the market. And so, we are, as far as the salaries are concerned, are there some areas we may be a little lower than the market, but there are maybe other areas we're just at the market or a little bit ahead of that. But I think if you take a general look across the board, we're competitive in the market.
Okay, and my other question. Now, you said our human resources, our human resource officer, so to speak, we're sharing her with other of these?
Well, right now with Calhoun Liberty Hospital, and they're covering some of her salary costs.
That was going to be my next question.
They cover some of her salary costs. So we're able to actually save money by having her utilize at.
Is Alliant saving money, or is Franklin County saving?
Franklin County is. Franklin County.
You see where my.
Oh, no, I
my
understand.
brain went
I
there,
mean,
'cause
if-
if she's working 3 days here and we're carrying 90% of the salary, and then Calhoun's kind of getting a free
Yeah.
one there.
Yeah,
And then go ahead, I'm sorry, Dave.
Just going back to the salary parity, we've been doing since I started in 2019, we implemented a salary parity model here, because we couldn't bring everybody's salaries up competitive all at one time. So we just did a little by little. We had some people that came to work at Weems, their salaries was high. Then you had some that worked for years and they were low. So we just began to do a salary parity model, and we're bringing everybody up. We're not where we want to be at right now, but we kind of like in striking distance on some of our salaries. So that's something that'll be ongoing that we'll do.
What my biggest concern with the salary, and the reason I ask that is without registered, let's just say it, registered nurses, you don't have a hospital.
exactly.
Yeah.
You're not going to be able to operate a hospital with LPNs. You have to have that registered nurse. And that's always been a problem in the past. As you know, my wife has been employed there in the past before, but I know some of it. I'm quite sure Commissioner Ward, being from the medical background, knows what I'm talking about. But we've always had a huge problem with our RNs being underpaid, so to speak, on an average salary compared to Sacred, TMH, or anywhere close. They've just been, they've been lagging for a long time. Now it seems like we've been top heavy for a very long time. Administratively, but we just hadn't been there. And what fears I have is that we're going to have this exodus or continued exodus of registered nurses till we get to a point to where now we're going to have to bring in travel nurses, which is much more expensive. You may lose that the benefits packages, but the salary is tremendous when you're talking about travel nurses to be able to fill those shifts, because you're not going to be able to operate as an emergency or ER without the licensed nurse, so to speak. And that's one of the biggest things that I worry about in the future with Weems. And I don't think a lot of people understand that point. When we sit here and talk about salaries, people say, oh, well, you want to give people more money. But we need to give money to the ones, the actual healthcare providers that are licensed, because if we lose that staff, we're going to lose our hospital.
Yeah. We were getting poached. What I mean by that, people get recruited out because our salaries really wasn't there. We didn't have any benefits either.
Yeah.
They didn't have, there was no retirement. And those are things that, we're looking at. We made some strides, but we still got to do more work to get it up there to be more competitive to our people around, our sister hospitals that are
Just out of curiosity, right now, how many licensed RNs do we have on staff at Weems?
License.
You registered nurses, the ones that's signing off.
Sign off, we probably have about, Courtney may have about 10 or more, I don't know the specific number, because we have some full-times and we have PRNs, part-times with benefits and part-time without benefits as well.
Well, we can get together later. That was a question I'll ask later. Yeah.
I'd just like to add to your comments, and I think you're right on track. I mean, one of the biggest issues facing healthcare organizations right now, especially coming out of COVID, is the salaries of what we're facing. If you look at some of the national reports out there, and there was recently Becker's, which does a lot of research in the healthcare industry, and one of the biggest challenges out there facing organizations across the country, I'm not just talking here locally, is where salaries are. Some of the biggest expenses that the hospitals are incurring, and the challenges coming out of COVID, because what has happened is we as an industry knew, around this time, we were going to be hitting a period where the remaining baby boomers were going to be seeking retirement. So we were faced with what we knew coming down the road was a retirement and a shortage in the healthcare professions. But when you threw COVID in there, it exasperated that, because a number of people chose to leave the healthcare professions. We talked earlier about COVID and paramedics and what that has affected to do. So you couple with the baby boomers retiring along with COVID and people leaving the workforce, it put our industry as a whole in a very precarious situation where we have to focus, and this is something we can all do, is focus on our middle school, high school, students and working with our schools to promote these health occupations, because we've got to build that workforce for the future. Salaries is important, and that's why we see them escalating, because there's such a limited resource out there. But we as an industry have to work here locally with our school systems to be able to encourage individuals to get into those professions as we move forward, because that's the only way we're going to be able to get out of this crisis that we're having as far as the staffing across this country.
Well, I understand the COVID, but trust me, we had an issue way
Oh,
before
sure,
COVID came
sure.
up.
No,
As far as, I mean, the problem we have is that we, like I was stating earlier, our medical professionals, the ones that's actually putting their hands on you, it's been a problem.
Yeah.
I mean, we've got people out there, we've got RNs that's probably got 15 plus years experience, that's still under a $30 an hour gap.
Right.
And you and I both know that anywhere else, that they would be well over, and so our comparison is really bad. So whenever you got a young graduate, and we have kids that's coming out of our school that's becoming RNs and stuff, and they're sitting there looking at it, it's not it's not a real big incentive to come home and work at Weems. They'll drive 20 minutes to St. Joe, or either just commute to Panama City, because they're, if they have any sense, and most of them do, is they're looking at 10, 15 years down the road, how much growth have I had there? And that's the problem that I see, the foremost problem, because like I said, at the end of the day, when you run out of RNs,
Yeah, you can't take care of
you
patients.
don't have a hospital.
Yeah, you can't take care of patients.
Exactly.
Yeah.
I mean, I love our doctors, but they're in there sleeping, they'll come out and check and go back, but those right there, the ones that's licensed, ones that's signing off on this and that, whenever you lose that, we lose our hospital.
Exactly.
Anyone else have any questions?
Mr. Chairman, Mr. Cozart, thank you for being here today, along with Mr. Walker. And I think that, I'm hoping that you'll come back and give this board an update periodically about the success of Weems and what you guys are trying to do. The next time, though, I'd like some numbers.
Sure.
To see, you said we're breaking even. I want to see numbers,
Okay.
data that you can provide, so that we can know that we're providing our citizens with what they need at a cost that they're paying for, that's conducive to what services we're providing for them.
No, I'm happy to do that, and I can get with Michael and schedule a time in the near future here to be able to come back and give you some numbers to support what I'm saying here. So I appreciate that comment, and I'm happy to do that. So.
Thank you.
And just one more thing. That was another thing, I'm glad you reminded me, I kind of got just staff related there, but that break even, that kind of scares me when I hear we're just breaking even, because we're talking about possibly building a building, so that means we're going to accumulate a mortgage down the road. I'd rather be in the green going forward with a house payment than
Breaking even?
yeah, breaking even. That just kind of makes me a little nervous. So
Yeah,
to speak.
and most rural hospitals, nationwide, is in a big deficit. Nationwide, there's a big study that just came out. Now, when we build a new hospital, the new concept we want, ED, the performer has already been done. The money for that new facility will come out of the Healthcare Trust Fund. And so the Healthcare Trust Fund can't afford that. A few years ago,
I'm sorry?
yeah, it can. A few years ago, the county had a $10 million loan from USDA. It was around 3%, I believe, and the payment was $457,000 per year. The Healthcare Trust Fund, since the time of its inception, has been bringing in more than that payment per year. And so the performer is already there. You have the money to make that payment. And so Weems' operation account would not have to make that payment. That payment would come out of the Healthcare Trust Fund. So you got two different funds here. You got the Healthcare Trust Fund, and then you have Weems' operation. Any money that dealing with the building of this facility comes out of the Healthcare Trust Fund, and the money is already there.
So you're saying the capital outlay side of that?
Yeah, the
versus
capital-
the operation
Yes,
side?
yes.
So the payment for the mortgage payment, so to speak, would come from,
The capital outlay.
how many times have we had to go to capital outlay though? And, you know,
Yeah, but we, yeah.
I'm just saying, I closed the door down the road.
Yeah,
so
yeah,
to
yeah, we
speak.
have. Now we want to make sure we fiscally sustainable
Yeah.
on the operational side. Since I've been the CEO, you know, we hadn't been in the capital outlay funding, you know, probably one time when I first started, I believe. But the money has been there. You know, I think the capital outlay brings in $1 million and some dollars per year, per se, roughly. You know, and so that payment could have been made since 2007, 8, 9, 10, because you had more than $400,000 per year going in there. You know, and so it's, you know, whatever payment, if the county goes for a loan, if it's under a certain amount, for example, you know, that payment can be made there, you know, for the new building. But hopefully, if we look at it, we may not need to do that. I'm just talking out loud here right now. But the performance has already been completed, because if you look at every year, that capital outlay money, you know, you got 1 point something million in there every year. If your payment is only $400,000, you can make that payment per se, as long as you don't do operationals. As long as the operational wings don't keep going in there grabbing money out,
Exactly.
you know, and we don't want to do that. What I want to do, my vision is this: we can get this hospital so sustainable. The money that we get from the county, $1 million a year, probably from the county for the sales tax, we can put that money to the side, and then that money can be used for salary increases, you know, to get us salary parity, you know, and give us annual increases for our staff. You know, our staff, prior to I started, haven't gotten raises in years until that debacle happened years ago, you know. And so you had staff that never got any increases. And so the idea for me is that we can get so sustainable, we're not counting on that money that we get for the sales tax. You know, that's where we want to be. You know, that's just my vision. Some people may say it's just too broad, but that's why I want to be so sustainable that we're not even counting on the sales tax money that we're getting. We can use that sales tax to really put back into staff. You know, that's just my.
No, and I agree with you. That's exactly the way it should run. It should run like a business, because at the end of the day, it is a business.
Yeah.
And
yeah.
break even scares the hell out of me. I'm just going to be frank. I mean, because, you know, just a hypothetical. I mean, you know, you got a mortgage. We're looking in the future. We get our ER. We got our house payment, so to speak. We still have other things out there. We have our beds, you know, our actual floor. And I mean, it's an old building, so you got to maintain that. You still got to pull out capital outlay to maintain that. You know, I guess what I'm saying is just break even. Use another term next time.
Yeah.
I will. I apologize for it.
I'll sleep better. Let's put it that way.
You know, I mean, and I probably should have said that, you know, we're, you know, fiscally sustaining our operations is really what we're doing, because when we use that term, that means we're covering our, you know, we're covering our expenses, we're covering our salaries. You know, is there excess profits? Not right. They're not there yet, but we're sustaining the expenses that it takes to operate the organization.
So I'm sorry. But what I've got, everybody's that way. But our future potential profits is based around a new building, or do we have a business plan going forward as far as services? We're going to start doing GI again, or?
Some of the things we talked about this morning are what's going to enhance our revenue capabilities for the organization. You know, the example I gave with the care coordination, the intensive outpatient program, those services. You know, we just recently added mammography to the organization that hadn't been offered before. That's going to enhance the revenue that we're not seeing in our financials yet, because it's just relatively within the last 60 days been implemented. So a lot of these programs and services that we are adding is going to enhance the financial stability and improvement of the organization.
Yeah, and one of the things too, you know, if you look at the sustainability of our hospital, you know, we've been trying to make it off a ED in our clinics and our EMS, you know, without the inpatient volume. You know, you cannot succeed like that. And so any inpatient volume that we get at the hospital, you know, that's where our increase would come from, because we don't have to bring in a new respiratory therapist. He or she there will be 24 hours a day. You don't have to bring a lab tech in because they got to be there 24 hours a day anyway. You don't have to bring a radiology tech in because they got to be there 24 hours a day. So the only staff you would need is your 2 RNs, basically, you know, the staff of inpatient unit. But the reimbursement that we get for inpatient or swing bed, because we're a critical access hospital, is such a good amount that we can increase that flow there, then we can begin to look more, we can begin to look at a more positive cash flow for the hospital, and then implement some of these other programs, intensive outpatient, mammography, look at getting scopes back here, you know, here in this community, you know, looking at wound care, an infusion center. We do infusion service now, blood infusion services now, but we need to grow that to another level. You know, we also can look at cardiac rehab, you know, things like that, that we can begin to implement here in this particular county to grow our revenue base. You know, so there are some things that we can do to grow it, you know, that can help our bottom line here, you know, at Wings, you know. And so I think the inpatient part is very important for us, because that's where I can see some of the growth opportunities will come with.
As far as the swing bed program, that's been there.
Yeah, the inpatient swing bed program has been there, but we hadn't really maximized it, you know, because we didn't have a inpatient rehab, quote unquote, swing bed coordinator to reach out to these 4 facilities in Bay and Calhoun, Bay and Liberty, Bay and Tallahassee. So with the care coordination position, you know, that position will reach out directly, especially to TMH, and we can get those individuals back, and then we can hire maybe somebody part-time to reach out also to our capital HCA in Tallahassee, Sacred in Bay County, as well as Gulf Coast up there in Bay County as well, because a lot of our patients go back to those facilities there, but they can be coming here, you know, so we just got to make a more concerted effort with that.
And to give you an example on the swing bed, and I don't know the exact reimbursement here at Wings, but 4,700. So, you know, for every patient day, you know, for your swing bed patient, you're generating over that length of stay, and it's 4,700 per stay?
Yeah, either 47 or 36. I think the inpatient is 47, and swing bed maybe 3,600.
3,600 in additional revenue. So again, going to your point about how do we increase, you know, the financial viability of the organization, is bringing those patients back, because that's revenue that's going to other locations that could be done here.
I know y'all doing a good job, but I bring up questions, because I want to get these hard questions on out the way so we can move forward. And just the public can know it, and everybody else, once they know it, that's the only revenue, can't nothing hold us back this time. It's always been a blocking stone to stop it. But I'm trying to let everybody know. And y'all doing a good job. I know you're doing it. I've been watching it for 18 years. And y'all keep up the good work, as far as I'm concerned.
I appreciate that. I mean, you know, we have an excellent team here that's, you know, really focused on how do we continue to improve our organization on a daily basis. And, you know, as I said earlier, it's a pleasure for us to be associated here, because, you know, I've been running hospitals for 42 years now, and most of my career has been in rural health care. And my passion is making sure rural hospitals survive, because that's the lifeblood of our communities. I live in Chipley, Florida, in a small community. You know, it's important to me, and it's important to the residents of our community to have a viable organization that's providing the care that they need in their community, because we've seen so many times when communities lose their hospital, they lose a big part of their community. And in many cases, and I'll use Graceville, Florida as an example, when that hospital closed, nothing came back into that town. They lost 200 and some jobs. The community is struggling. There's a small town in Alabama. I'll give you another example. When they lost their hospital, they went from a 3A classification in a school district to a 1A classification because there weren't people moving into the community wasn't growing, and it had a direct effect or a direct correlation onto that community. So that's why it's so important for us to be able to see and appreciate the value of organizations like Weems Memorial Hospital to our community, and helps our community continue to grow, because who wants to go and move to a community or locate in a community that doesn't have health care?
I've got one more question. I'm gonna leave you alone, Mr.
Sure.
Coase.
No, that's
This is
fine.
just a line, because I'm the freshman.
Sure.
Whatever we call that, a rookie. But, with regards to a line, do y'all, work with, like these other hospitals we just spoke about, are they all critical care access hospitals also?
Calhoun Liberty is critical access. Chipley is critical access. Doctors Memorial is basically a PPS. When the regulations changed that allowed hospitals to move to the critical access status, they chose not to go that. Now we are assessing to move them to critical access because of the advantages for an organization to be critical access, and as David outlined, you know, the financial compensation we get from the federal government covers our cost. Critical access hospitals get reimbursed in a different mechanism than, say, a Tallahassee Memorial, or in this example, Doctors Memorial. We get paid based on 101% of our cost on Medicare patients.
That's patient cost.
You know, so we get paid basically when a patient is discharged from our hospital, we get 101% of what it was the cost to take care of that patient. So that's how critical access hospitals, very simplistically, are reimbursed. But Alliant currently manages 10 hospitals. 7 of those 10 hospitals are critical access.
Now, on that critical access, me and Mr. Walker, and I think your financial officer, we've had a discussion on this because, you know, me being the type of person I am, I'm trying to figure out why
Sure.
does everybody want our critical care access? I mean, it's got to be more than just 101% reimbursement. Well, what was the gentleman's name again?
Tom Ramsey.
Yeah, Mr. Ramsey. It said something about also with that critical care access, it compensates up a certain amount of your salary also.
Correct.
Okay. What's the exact number of what it's compensating as far as our salary portion goes?
40 to 45%.
So it's compensating for 45% of our salary, so we're getting reimbursed for 45% of our salary overhead, so to speak.
Exactly.
And it's, yeah, and all expenses, you know, of the hospital.
Yeah. But which salaries are a part of that, that's, you know, but it equates to about 45%.
Then it allow you, I'm gonna stop here. It allow you also, if we build a new building, it allows to write off the depreciation of that cost also, Michael?
Yeah, and back to your question before, you know, if we finance any part of this construction project for the hospital, any of the, you know, the interest and depreciation on that gets accounted for on your cost report. So you're actually getting a percentage of that cost back to the hospital that you normally wouldn't be able to get that. So, there is an advantage. I mean, to your question earlier, how do we pay for it? And I think David explained based upon that, but also it benefits the hospital because if there's any, you know, interest and depreciation, that gets calculated into your overall cost, and that affects our reimbursement, actually increases our reimbursement also.
And going back, like Commissioner Larkin said, we ask these questions that way we and the public, everybody understands exactly what we have here and how it's going. As far as like that critical care access, I mean, it's huge. I mean, I was always under the impression it was just the 101% reimbursement, but it's much, much bigger than that.
It
And that's
does.
what
I
I
mean,
said
it-
earlier. I mean, it has to be a bigger card in your pocket, so to speak, because everybody wants it. It's got to be more than just that. I mean, because if you look at our patient load there, we're rather low. I mean, you're getting a little bit, but I mean, if it was in a bigger area, obviously it'd get a lot more reimbursement. But so in my mind, I was like, well, what is it that everybody wants?
Mm-hmm.
And it's that I would be willing to bet everybody's more wanting to get that 45% reimbursement on salary and whatnot, because that's on a bigger scale percentage-wise. If you're talking about a hospital that's just for easy math, $1 million versus a hospital that's $60 million. Now, who's making more money with 45% reimbursement?
Yeah. Well, and again, I think.
And with that, does that cover like Alliance
Yeah.
salary, so to speak? So
Yeah,
that's what incentivizes your company to go out and get critical care access hospitals and manage them.
Well, and as David explained, the management fee that the hospital pays Alliant, a portion of that gets reimbursed by the federal government because that goes into your cost. So, when we talk about the management fees to critical access hospitals, we always try to explain that a portion of that you're getting back through your cost report, because that is a cost that goes into the equation for your reimbursement. So it does. There's advantages. Another advantage, we talked earlier about the 340B program. Critical access hospitals automatically qualify. One of the reasons, going back to a previous statement, Doctors Memorial is what's classified as a PPS hospital. Well, they've seen their Medicaid volumes drop in that community and what's utilizing the hospital. So they're at risk of losing that 340B. For that hospital, that's $1 million a year. But if you're critical access, you automatically qualify, and you're automatically in the program. Like a doctor's, they're at risk for their 340B based upon their volume. So that's another big advantage for the organization also, is being able to maintain and not have to worry about, do you constantly qualify for enough Medicaid patients to be able to keep your 340B program. We don't have to worry about that here.
Thank you.
I got one more thing.
Go ahead, sir.
Sure.
We're getting educated today. Go ahead, sir. It's all
When
good.
I first came on board, I was with 18 years. Commissioner Sanders can tell you, the first task they stuck me on was the hospital boat. I'm at the hospital, go up Tallahassee, talk to the congressman, I think it was Alamo. And man looked at me, he said, well, Commissioner Locke, y'all want some help, you got to help yourself first. That was it. They just straight out told us, I mean, we got up asking for this, asking for that. And now we in a position to help ourselves. We need to do it. That penny, what we collecting, we didn't have that back then. And it make a difference. It really do. But y'all, everybody need to know so we can move forward. I appreciate y'all coming.
Well, thank y'all. Thank y'all for, and again, I'll come back, in the near future and bring some more financial numbers for y'all to be able to show you exactly where we're at.
So let's do this if we could. It might happen before, but if not before, at least this is the second meeting in January, beginning of the year. Let's plan for you guys at least being back here by the second meeting in April. That's the quarter.
Okay.
Maybe we can have those numbers and stuff to look at ahead of that time. I do want to clarify a couple of things, not to rehash them, but to make sure everybody understands what we're talking about. So the $15 an hour minimum wage is something we know the whole state of Florida voted for. That's the reason we, as a board, have tried to do things with our pay plan, because by 2026, everybody has to be at 15. And we don't want to have compression issues because the people that have been working there 20 years don't need to be making $2 more than the guy that started last week.
Exactly.
So we address that. However, with healthcare, the state last year mandated it's time to move that $15 an hour right now, as of November of last year. You got to start doing it now. But it's still coming, and it's going to affect the hospital just like it does everyone else. All the other auxiliary staff, or ones that aren't touching patients, are still moving toward that $15 an hour minimum wage come 2026.
Right.
So it's just one of the things we're having to deal with. And I don't know for sure that everybody knew that that was an immediate thing that had to be done, that was mandated by the state. I just want to make sure everybody knew that. And as far as when we start to look at things that we can expand and do, I can tell you, and this is going to sound like a dead horse, and I apologize for that. You might not have heard it, but others have. The people that need care more frequently than anybody else are dialysis patients. And they're all traveling an hour and a half to 2 hours, 2 or 3 times a week, sometimes more, if they can afford it, because they cannot get it here locally. The other thing I will say is, and you might have to help me because I don't know that I know, but it seems like I remember reading with critical access hospitals, there is if Williams started having 15 patients a night check-in, not swing beds, patients a night, would not we be deemed unqualified to be a critical care access hospital?
No.
I thought there was a number of patients you could have.
You know, critical access classification is that your average census for your inpatients has to be 25 or less.
Okay.
So
I knew there was a number, that's why I was
yeah,
asking.
it's 25 or less. But again, this is an average, and a lot of times we talk about it's just an average of your acute admissions. It doesn't take into consideration observation patients. So a typical hospital, for example, may have 10, again, using example, may have 10 patients classified as inpatient and 5 classified as observation. The observation patients don't go against that 25. So even though in-house you're treating 15 patients, only 10 of those get classified. And then again, it's on an average. So you can actually, as a critical access hospital, and I'll use Chipley as an example, it's critical access, 25 beds. Post-Hurricane Michael, when we were the only hospital open in the area, we were at 36, 37 patients. But again, it wasn't our yearly average. We didn't exceed that 25 on a yearly average. So you can go above the 25, but you can't do it on a consistent basis that's going to take you above that. But it's 25.
But I think you're probably thinking about, Commissioner Jones, the length of stay. You know, you have to be in the inpatient unit no more than 3 days.
Okay.
Yeah,
That might be it.
that's what you were thinking about.
And again, that's on an average. It's not just every patient has to be discharged at the end of, 72 hours or whatever. It's your yearly average is what they look at. So if your yearly average is below a 4.0, then you're fine as far as meeting that requirement. But those are the 2 requirements that you have, is on the length of stay, the average length of stay, and again, it's only on the acute care patients, and it can't be more than 25 beds.
Thank you. Appreciate it.
Well, again, thank you all.
Yep, yep.
Thank you.
All right, so let's take a 5-minute break and then we'll come back to planning and zoning.
Yes, sir.
We understand that managing a healthy lifestyle while balancing life's other demands can be challenging at times. So the Florida Department of Health in Franklin County is dedicated to supporting you as you take care of your health. We offer many resources and services including, but not limited to, COVID-19 vaccines, breast and cervical cancer screenings, tobacco prevention and cessation education, and information on heart health, nutrition, and physical activity.
Maintaining a healthy lifestyle can help to prevent chronic conditions like heart disease and stroke, diabetes, COPD, and obesity. Healthy lifestyle changes can also help you maintain a healthy immune system. Tips to good health include eating a healthy diet, being physically active, avoiding tobacco and excessive alcohol, managing stress effectively, getting enough sleep, and seeing your medical provider for routine checkups.
To find out more about how we can help you maintain a healthier lifestyle, please visit franklin.floridahealth.gov or call 850-653-2111.
Hi, I'm Carol Landis. I'm a professional realtor in love with St. George Island. When my husband and I and our dogs moved here in 2002, it was the beginning of an adventure that has never grown old in a community that is amazing. If you're thinking about moving to St. George Island or investing in our world-class real estate, then this community will be as important to you as the sand and surf.
Well, Kara to me is much more than an agent. She's become a friend, and since we bought the house, we've needed work done, and she knows everybody there is that can help us with that.
One of the key elements for the historical growth and value of St. George Island real estate is the fact that it's a great place to vacation and to live. The beauty of the Gulf of Mexico with its white sand beaches and blue sky has always been a magnet for me. It was love at first sight. As your realtor, I can help educate you on the various aspects of buying and owning coastal properties. From taxes to coastal setback lines to where to find the best oysters, it's all part of being your realtor.
Too often our friends tell us of it being a hardship to buy a house, and the agent was gone as soon as the closing. We've had quite the opposite experience with Kara.
If you're looking to buy or sell real estate on St. George Island, I'd love to work with you. Please call or text me at 850-653-7753.
Our beautiful piece of paradise, please make sure you visit our local shops, restaurants, galleries, and take some time to experience something different and take a fishing trip or tour with one of our experienced guides. Our neighbors and their businesses are the heartbeat of our community. Thank you for visiting, and remember to shop local, eat local, and fish local. This message is brought to you by the Apalachicola Bay Chamber of Commerce. Fisherman's Choice Bait and Tackle has all you need for your day of fishing. They have fresh and saltwater bait, an unmatched selection of mirror lures, and a wide selection of Berkley Gulp, plus fresh and live bait and all the rigs and tackle you need for a great day of fishing, including brands like Penn and Shimano. They are also the only bait and tackle shop in Franklin County where you can get a fishing license. And don't miss their wide selection of marine supplies, coolers, and more. Fisherman's Choice is located at 330 Highway 98 in East Point.
Franklin County Board of County Commissioners now back in session. We're going to our Planning and Zoning Adjustment Board report. Ms. Bankston, please proceed.
Good morning, Commissioners. I had a very short agenda for P&Z last Tuesday. So I just have 4 subtitles for you. Critical shoreline application, 1 commercial site plan, 1 preliminary plat, and 1 ordinance amendment. So first we'll start off with the commercial site plan application, and this is for, the critical shoreline application for 2364 Schooner Landing. This is for a 1928 square foot single family private dock with a 4 by 18 access walkway and an 8 by 38 terminal platform, 13 by 38 covered boat lift, and a 17 by 38 covered boat lift. This was submitted by Aaron Sarchet, agent for Stephen McDaniel, applicant. State and federal permits have been received. The board did take a look at this application and they did vote for this to be approved.
Ms. Courtney, was there any discussion about repairing rights that well out of everybody else's way?
This is one of those that because of it's in Bob Sykes Cut.
Yes.
Those have different
Yes.
regulations, and the state did not require them to have that repairing.
Okay.
The 25
All right.
foot on each side.
All right, pleasure of the board.
And you said the P&Z BOA board approved this?
Yes.
I'll make a motion to approve.
Jane? We have a motion to approve by Commissioner Ward, second by Commissioner Amison. Any discussion? Seeing none, all in favor? Aye. All opposed? That's unanimous. Please proceed.
Okay. Next, I have the commercial site plan application for 79 Ottersline Road. This is for a 12,000 square foot pole barn located in East Point. The application was submitted by Bruce Millender. The applicant does meet parking and setback requirements. The board, let me make sure I didn't have any notes in here. The board did a motion for approval for this. Board member Rachel Chestnut did have a voting conflict, so she was not able to vote on the item, but it did pass unanimously.
And Ms. Bankston, the any stormwater issues that were had were addressed? as
Yes,
well? Okay.
correct.
All right.
Me and Mark actually met with Bruce a couple of times on this application,
Yeah.
and we finally got it to where it was okay to go before the board for approval, so.
Okay,
he's
I'm
met
just
those
asking to make sure Mr. Miller kind of checked all the boxes, that's all. All right, pleasure of the board.
And again, P&Z BOA recommended approval.
Correct.
I'll make a motion to approve as well.
We have a motion to approve by Commissioner Ward, second by Commissioner Amison. Any discussion? All in favor?
Aye.
All opposed? That's unanimous.
Okay. Next, I have a preliminary plat application for Boondocks by the Bay. It's 4 lots located at 1911 and 1917 US Highway 98 East in Carabel. This request was submitted by Thurman Roddenberry, agent for Daniel Floyd, who's the applicant. The board did motion to proceed for final plat. So they did approve for final plat. As you can see, these are the lots here. I did do some research on it. These are unrecorded. This was in an unrecorded subdivision or plat. So the homeowner is able to split these lots into 4, and he's met all minimal requirements and acreage for the 4 lots.
And this is just for the preliminary plat review, Mr. Chairman? I'm
Yes.
sorry. Okay.
And after this, they'll move on for the final.
And it's just the 2, correct?
4, there's 4 lots.
Was it 2 on the road front and 2 further back?
Yes.
Okay. Thank you for the clarification. Pleasure of the board.
Motion to approve.
Second. Have a motion approved by Commissioner Sanders, second by Commissioner Lockley. Any discussion? All in favor?
Aye.
Aye. All opposed? That's unanimous.
Okay. Last but not least, we have an ordinance amendment for Serenity Seaside Resort. It's a PUD draft, and short story is they're trying to change a few things, including an egress off to South Bay Shore Drive. There was a lot of questions asked during this meeting. Mark was there to answer a lot of the questions. One of the biggest discussions that we had was regarding DOT, and did DOT recommend for them to have the egress come out of South Bay Shore Drive, and there was no recommendation from DOT. It was also noted that he was unsure as to whether DOT was going to even approve the application for that change. So that was one of the biggest discussions that came up during the meeting. I know there's other stuff that involved in that PUD, but they did recommend it to go for the public hearing so that all of that could be discussed.
And that's the request today, correct?
Yes.
To approve going to a public
For
hearing?
a public hearing, yes.
Okay. Pleasure of the board.
Just for clarification with that DOT is recommending to move the entry. They're not?
They have not made any recommendation, and as far as Mark did address at the meeting, that he's not sure if DOT is even going to give them a permit for.
Well, they just want a public hearing.
Yes.
Just want a public hearing.
Yes.
Yes.
So moved.
Motion to approve by Commissioner Lockley. Do we have a second?
Go to a public hearing,
Yes.
right?
Mhm.
I'll second it.
Okay, we have a second by Commissioner Sanders. Any discussion?
I have a question.
Yep.
Being that they're requesting the public hearing to amend the current PUD ordinance, the egress is now noted in a different area. What in DOT, do they have to approve that this egress is?
I'm not sure. They do have to approve changes like that, but I'm not sure.
Because my concern is this, if we do a public hearing based on what's presented to us in that public hearing, and they decide to put the egress back where it was originally supposed to go, which was, I think, was on Island Drive, is that gonna change? We're gonna have to do another public hearing based on that?
Commissioner, as I understand it, there are two fundamental issues that would be addressed at the public hearing. One is the ingress and egress relocation from Island Drive, where it was originally approved, over to South Bay Shore. That's one issue. The other issue is, as I understand it, although I haven't been participating in the meetings between the developer and Mark, but the other big issue, as I understand it, is they are not necessarily increasing the amount of their density that was originally approved. They're just relocating it on the parcel. And none of those changes can be made unless there's a public hearing.
Okay, thanks for the clarification.
Yes, ma'am.
Did you want to add, Mr. Chairman, did you want to add something?
No,
Mr.
Dan
Wallace?
Garlick for Serenity, but if you've got some questions about the DOT issue, I mean, basically DOT regulates State Road 300. Franklin County regulates South Bay Shore Drive.
Yeah.
Basically, DOT indicated that since there was a crosswalk that was established after we had received the PUD, that they had an issue of where our ingress and egress was at that point. So they recommended to go to someplace else. They recommended to go to Island Drive. They don't have jurisdiction on South Bay Shore Drive, just like they don't on Begonia. But they basically said that through a series of emails, which Mark does have, but I don't know if he,
They're on here, yeah.
Okay,
they're-
so we actually had communication with DOT, and they're the ones that made that recommendation. There was some discussion about, well, how do you know that? Well, we could apply for a permit, and $10,000 down the road doing the road traffic studies, then they'd say, no, you can't. I mean, that's really what it comes down to. So we do have the emails that with correspondence with DOT that recommended that we look at going down South Bay Shore Drive. That's how we got to that point.
Just trying to get some clarity there, because I was told that DOT did recommend and didn't recommend, so I didn't know who's recommended.
Well, and that's actually, we're not having a public hearing today. But that will come out in the public hearing, you know what I mean?
Yeah.
They're asking for the ability to be able to take it to the public hearing.
And
So we can ask questions like these.
And at that point in time, we'll be able to give you a full presentation on
Right.
the changes and all those things, the interior and all that.
And
Thank
to clarify, so what Mark stated was that they hadn't formally asked for the permit for off of South Bayshore Drive, so they couldn't give them a yes or a no to approve, but they did recommend for them to change
Yes.
the location.
Yes.
Yes.
Well, there's
So-
only one or two locations.
Yeah.
It's South Bay Shore, Begonia.
Yeah.
There's only one or two locations.
Yeah.
So, all right, any more discussion before we vote on this potential public?
I'm like you, Mr. Chairman, all that will come out in the public
Yes,
hearing.
yes, ma'am.
And then we can make our minds.
Yep. All right. All in favor? Aye. All opposed? That's unanimous.
And that is all I have for you, unless you guys have anything for me.
I think you're good today. Thank you, Ms. Whitney. All right, so next we'll be opening some bids. Ms. Erin, while we're getting ready, I do want to ask a question just to clarify something. On this first bid opening we're doing today, it says Carabel Beach Wayside Park Pavilions and restrooms. I thought we just redone those restrooms like 3 or 4 years ago.
We did, it's actually the exterior of the restroom.
Okay, that's what I wanted to know. Okay,
They're actually deteriorating.
that's good. No problem. Go ahead.
Yeah, and this first bid opening is going to be for the Carabel Beach Wayside Park Pavilions and restrooms. This project includes, but is not limited to, miscellaneous site work, cast-in-place concrete repairs, masonry, miscellaneous steel, selective demolition, joint sealants, and painting. And the first company is going to be Ram Construction out of Midway, Florida.
Got a bid bond?
Okay, yep, bid bonds on top. And let's see. Ram Construction, their bid is $424,000. Again, $424,000. Next company is Aris General Contractors Incorporated from Tallahassee, Florida.
Bid bond?
Bid bond is included. $393,381. $393,381.
I'm the only two.
That's the only two. Yep, and with these bids, we will actually release them back to Doug Schuler with the architecture firm, and he will actually review and make a recommendation. And this project is being funded by a historic preservation grant, some Hurricane Michael insurance proceeds, and then also any deficiency will come from TDC sales tax proceeds.
I make a motion, we send it to the people. So let them check it out.
I'll second.
Mr. Lockley made the motion to do that, to send it to them. And,
Engineer.
yeah, to the engineer, and Commissioner Ward seconded that motion. Any discussion before we vote? All in favor? Aye. All opposed? That's unanimous.
Hey, Commissioners, this next project is our second time bidding this project, and it consists of the construction of a dune walkover project located at the end of 3rd Street West on St. George Island, specifically between DEP monuments R82 and R83. The pile-supported structure is 6 foot wide by 187.8 feet long for an area of approximately 1,127 square feet. One thing to note on this project, because it is has been upgraded for commercial construction standards. The new path is going to be 6 foot wide instead of the standard 3 foot wide as the old dune walkovers were. And then also all of the piles that support the dune walkover are actually driven according to the specifications 12 feet deep. So So it should be long-lasting.
One other question. Does this length take into account that it's not all the way up to the road? That it's back far enough that we can start to develop, like we've talked about on St. George? When we're redoing these boardwalks, we want to move them back further toward the dune line so we can begin to create perpendicular parking to the road. If there's 6 spots there, there's 6 spots there. But all of the parallel parking, we're going to start enforcing.
Yep, that is correct.
Did it include that?
It did.
Okay, thank you.
Okay, and on this one. Okay. First one that we have is J.W. Shuttlesworth LLC from Perry, Georgia. Total base bid, $115,986. Again, $115,986. And see, the bid bond is included. Okay, this next one is MKM Quality Construction Incorporated from Mexico Beach, Florida. Base bid $54,255.
How much?
$54,255.
You got a bid, man?
I am looking for that right now. Let's see here.
Hello.
Do not see a bid bond included with this one. So that's something that MRD will have to follow up with them on. So they may or may not be the lowest responsive bidder here. Okay, no bid bond was included. Okay, this next one is Aris General Contractors Incorporated from Tallahassee, Florida. Total base bid, $166,148.
Do they include a cashier's check for the bid balance?
Oh, okay, in the envelope. Okay, yep, cashier's check was included. Okay, my apologies.
Let's go back to the one that said no bid bond.
Yes.
It's actually a cashier's check.
Okay.
In the packet.
That is in lieu of. This one does have a bid bond. Yep, so again, this is for Aris General Contractors, and this one is $166,148. This next one is North Florida Construction Incorporated from Clarksville, Florida. $142,710. Again, $142,710. And the bid bond is included. Yep. And with these, we will actually release these back to MRD and Associates. He is our coastal engineer. He will review the bids, make sure that they are complete, and make a recommendation back for you all at the next meeting.
Motion to approve by Commissioner Sanders, second by Commissioner Lockwood. Go ahead, Commissioner.
I was looking at these bids and, well, one of them is kind of low. Would you have them, when they checking this, to make sure they be able to do the kind of work that we want?
That's correct.
With that price, you know, that we always telling them to get to the lowest bidder, but we want to make sure that they have enough money to do the work.
Make sure they're using pressure treated.
Yeah.
Some good stuff. Well, the other thing
Yeah,
too.
stainless fasteners.
The other thing too, Commissioner Lockley, if you're looking at it, so it's 1,127 square foot. It goes from $48 a square foot up to $147 a square foot. I personally think $147 a square foot's a little much, but you know, that's just me. But we'll see what comes back recommended to us.
Maybe one's using nails, one's using screws, who knows?
But they'll bring back a recommendation, correct?
They will, and actually, the awarded bidder will have to follow the specifications,
Right.
which the specifications package was about 100 pages long for this thing, so.
Hello.
We should have some.
So we have a motion, second, any more discussion before we vote? All in favor?
Aye.
All opposed? That's unanimous. Thank you, Mr.
Price of lumber eat up there.
All right, so Ms. Griffith, we're now moving on to you
Oh, okay.
for your report as our fiscal manager and grants coordinator.
Okay, Commissioners, the item number one, actually Michael just handed this out to you all. It's the included notice of award and then also the route diagram for the Alligator Drive multi-use path. After consultation with FDOT in regard to the bids for the CR 370 Alligator Drive multi-use path, phases 3 and 4, the recommendation is to award the construction contract to the low bidder, Robertson Robertson Incorporated, in the amount of $1,007,139.75. This is for a reduced scope of work to stay within the grant budget and will construct the multi-use path from East Harbor Circle to the S-curve. The county will need to submit a later application for another phase of the path construction to reach the marina area. And in the diagram that was just released to you all, the light blue section is actually the reduced scope of this phase that we're doing right now. And the highlighted yellow section is something that we will actually have to submit another application for because we did not have enough grant funds to accomplish the project.
Mr. Chairman, if I might, can I say something? Down there where the S-curves is, and continuing on toward the marina, the right-of-way is the people's land. So that, you know, that's the reason why it is what it is. So, but, okay, you need a motion?
Yep, board action to authorize the chairman to sign the attached notice of award and approve the reduced project scope.
So moved.
All right, we have a motion by Commissioner Sanders, second by Commissioner Lockley. I do have one question under discussion, Ms. Griffith. Do you have any idea, or do we know how many linear feet this is that we're doing? As far as length? And it can be close, half mile, quarter mile, 2 miles, you know what I mean? You know?
I don't know, sir.
Okay.
Let me ask another question, and I know I made a motion, but let me ask another question. Where is that stretch, the one in the red, that it says from 163 and 174 to be deleted from the scope of work?
That is actually the area of the new construction that Anderson Columbia just did on the revetment.
Okay.
And the bike
I thought it
path is
was.
actually on the side of the road in that section.
Okay, so that's the whole section. And, okay, I just wanted to make sure that we're still carrying on with what we're supposed to be doing at the fire department property. So that needs to still be in mind.
Yep.
That needs to be done.
Any more discussion before we vote? All in favor?
Aye.
All opposed? That's unanimous.
All right, Commissioners, next item. FDOT currently has 4 grant programs open for applications: the Transportation Alternatives Program, the Small County Outreach Program, the Small County Road Assistance Program, and the County Incentive Grant Program. The TA program constructs new sidewalks and multi-use paths. Franklin County is eligible to apply for 2 projects under this program. The deadline for the TA applications is February 23rd, 2023. Mark Currington suggests reapplying for the River Road Path in Carabel and applying for the portion of the CR 370 Alligator Drive path from East Harbor Circle to the marina as mentioned above, that the county is not able to build under the current grant. The SCOP funds are for use on the county road system and must be related to road safety improvements, resurfacing or reconstruction, repair or rehabilitating county bridges, road-related drainage improvements, constructing road capacity, and paving unpaved roads. The county is eligible to submit 2 applications, and there is approximately $20 million in SCOP funds available to District 3. District 3 is comprised of 16 neighboring counties, so just kind of put that in perspective. The deadline for the SCOP applications is March 17th, 2023, and that's the same due date for the rest of these transportation road grants. The SCRAP funds are for use on the county road system and are evaluated on the physical condition of the road, whether the road is used as an evacuation route, whether the road has high levels of agricultural traffic, whether the road is a major arterial road or a feeder road, and whether the road is located in a fiscally constrained county, and the impact of the project on the state or local economy. The county is eligible to submit 2 applications for this program. There is approximately $9 million in SCRAP funds available in District 3. The SIGP funds are for use on the state or county road system. If it is on the county road system, it must relieve traffic congestion on the state road system. The county is eligible to submit 1 application, and there is approximately $2.8 million available in SIGP funds available in District 3. Mark suggests 2 of the applications, either SCOP and or SCRAP, be for the segments of CR 30A and CR 67 phases that the county had to trim to bring the recent paving projects within budget. That will leave 3 applications available for other projects. Please submit requests for other project concepts by the end of the month to allow for time for review and assembling an application. Once project idea is for the county to apply for funds to finish paving Mill Road, but the FDOT has told us that paving unpaved roads is their lowest priority. Board action to submit applications for the unfunded segments of the CR 30A project, the CR 67 project, the Alligator Drive multi-use path, and the construction of the River Road multi-use path as mentioned above.
So moved.
Second.
A motion to approve by Commissioner Lockley, second by Commissioner Ward. Ms. Aaron, are there still a couple left that we can
There
try to
is.
submit?
Yep,
Okay.
there is.
And our deadline is when?
It's going to be by the end of the month because we have to have time to pull the applications together and also vet the projects, so.
By the end of this month?
Mhm.
Okay. Okay.
But we need to get this in to keep from losing it, right?
We do.
Mm-hmm.
We
need to
do.
Get this in to keep from losing.
And just to make the public aware, so if any of these are approved, they're gonna put it on their 5-year work plan.
Yeah.
So it's not like they're gonna turn around and do it next year if they approve it. It takes a little while. But, you know, we're getting there. We got some things coming up that were in that 5-year plan. We're closer than we were when they did it 5 years ago, so.
Need a 4-lane, 65, 67.
Any more discussion before we vote? All in favor? Aye. All opposed? That's unanimous. Please proceed.
Okay, Commissioners, next item, number 3. Franklin County received a $25,000 grant from Duke Energy to assist the county with the creation of a strategic plan for economic development. A strategic plan for economic development helps to steer the economic future of a community by outlining goals and the actions needed to realize those goals. The plan will summarize economic strengths and weaknesses and will provide insight on ways for the county to encourage growth and provide better support to local businesses. Several strategic plans for economic development for other entities are attached as reference for what types of analysis, goals, and implementation measures are included in a plan. All communities are different, and Franklin County's plan will be tailored for community demographics, location, region, and by local input ideas from stakeholders. Board action to advertise for requests for qualifications for the development of an economic development strategic plan and support services for Franklin County.
Pleasure of the board.
So moved.
Good motion to approve by Commissioner Amison,
Second.
second by Commissioner Lockley and Commissioner Ward. Any discussion? All in favor? Aye. All opposed? That's unanimous.
Okay, Commissioners, next line item is going to be item number 4. As the county's existing dune walkovers on St. George Island are now approximately 25 years old, it has become necessary to replace some of the oldest and most deteriorated structures as the County Parks and Recreation Department is no longer able to repair and keep the walkovers safe in their current condition. Dune walkovers serve as effective methods for erosion control by aiding in the preservation of natural dune topography and native vegetation. as Florida Statute 125 authorizes the use of tourist development sales tax proceeds for erosion control measures, I requested a proposal from the county's coastal engineers, MRD and Associates, to design, permit, and engineer the replacement of up to 4 additional dune walkovers. Those noted to be in the worst condition from the Parks and Rec Department are 7th through 10th Street West. Any replacement would have to occur before the start of sea turtle nesting season on May 1st. Board action to approve and authorize the chairman to sign the attached task order with MRD and Associates for the design, permitting, and specifications for up to 4 dune walkovers at a cost of $6,125 each.
So move.
Motion to approve by Commissioner Ward. Second by Commissioner Sanders. Any discussion?
Yeah.
Yes, sir.
How many, did they take account of all of the total of what bag?
We did. These must have been, they must have been the oldest dune walkovers, because those are in the worst condition. And actually on one particular dune walkover in this section, the railing section is actually starting to peel away from the decking. And it's becoming almost a safety hazard. So they are definitely at the end of their life, and after 25 years, that's pretty impressive in a harsh coastal environment.
Well, this is a low price. That's why I was saying.
If
the low should be, couldn't we add some more to?
Well, this is just for design and permitting. Yeah. This is just for doing the design part of it, Commissioner.
But the rest of them got to be designed.
Oh yeah, that's true.
Yeah.
Might well get the cost on that and wait now.
And actually, Commissioner, too, if the lowest bid is determined to be sufficient, by MRD, we actually have the option of doing a change order where we would then be able to go ahead and contract at the existing square footage price for the other dune walkovers if MRD can get them permitted and designed fast enough. So hopefully that will occur in this season.
So I think the question Commissioner Lockley is asking is why aren't we permitting more than 4 or designing more than 4? That's what he's asking, I think.
Okay.
Right,
Okay.
Commissioner?
Yeah.
It was more of a timeliness factor, Commissioner. That reasonably, it's probably not reasonable to think that we would have enough time to replace all of them before sea turtle nesting season. So we do have a plan of attack to start again, after September.
Yeah. No, my question, I guess I'm trying to save a cost down the road.
Yeah.
Is the permitting going to go up?
Yeah. The permitting should stay the same. Now, construction costs, that's something that hopefully we will continue this downward trend that we've seen in the last couple months. But
okay.
Can I ask a newbie question?
Yes, sir. You can ask all the questions you want to.
We talk about these dune walkovers and all this stuff. Have we ever, as a county, broached the idea of the matting? Have you seen that on certain beaches where they have that matting that goes down?
We do.
Have we ever discussed that?
We have added some. What the issue you run into, and I'm not saying it's a bad idea, but the issue you run into is if you're going to have matting and have places that are more accessible to people with disabilities, then you have to do other stuff as well. You have to have a designated parking spot at least, or maybe 2 for each area.
Mm-hmm.
You can't just throw a mat out there and say this is ADA and call it a day. There's other things you have to do as far as parking to go along with
But
it.
as far as these little piers that we're building, so to speak, or walkovers, we don't have to have any of that disability guidelines or any type of
No, because they're up over the dune. And we've actually have some places that allow for ADA. There by Lighthouse Park, we did add one of those mats, one of those Moby mats. And we do have money in the TDC budget to add more. We have to make sure where we're trying to put them is conducive to that it's not an area with dunes.
So we do have those mats over there?
We have some now, and we have planned to add more.
I just seen it on Facebook.
Oh, it's all good. And, but like we'll say where some of these dune walkers they're actual dunes still there. Well, even with a mat, it still wouldn't be conducive to, you know what I mean, to have a mat there. Because you're going over a dune.
Yeah.
And
I know it's just something that's on my mind. Like I said, I just seen it on Facebook. I mean, I might have a discussion with somebody and it spied on me and threw it up there. I don't even think it was in our country.
Yeah.
But it just looked pretty cool, when you got a mat going down to the beach. And I'm sitting there thinking, well, that's a good material that doesn't weather or whatnot, and we
But
just.
it does still weather, and it does still have some maintenance with it, matter of
But
fact.
the
Yeah.
lifespan is
lasts
much longer than,
probably.
than wood.
Yeah, because they have several at the state park on the island. That's kind of where we're like, look, if they can use it here, but you have to find somewhere that's really flat to make it
Okay.
work. Yeah.
I guess I need to go to the beach more often.
It's all good.
Yeah, Commissioners, and another thing with the Moby mats, also if we have a storm that's coming, it does have to be moved, so it does require some effort on our Parks and Recreation staff to actually roll those things up, so.
Just a question.
Oh, it's all good.
Go ahead.
Any other questions before we vote? We do have a motion, correct?
Yes, sir.
All in favor?
Aye.
All opposed? That's unanimous.
Okay, Commissioners, next item, Michael, are you able to share the screen with the graphic? Okay, on Monday, January 9th, the Playground Advisory Committee met with the vendor for LSI playground equipment and chose the design. In the attached inclusive design, there will be a larger play structure for children's ages 5 to 12, a smaller companion structure with integrated shade for children ages 2 to 5, 2 independent surface-mounted spinner pieces, and approximately 2,800 square feet of inclusive turf surfacing. The equipment is made in America and includes hot-dip galvanized aluminum and high-quality PVC components, all upgraded for coastal conditions. The $287,858.87 quote is based on pricing in accordance with the vendor's contract with Clay County, and piggyback contract pricing is an acceptable form of procurement in accordance with the county's purchasing policy. Unfortunately, as engineering and design standards require dedicated use zones and cushion fall heights for surfacing, there was not enough room or funding for a swing area in the design. The project budget is $300,000 total, with $200,000 in funding provided from the FERDAP grant, $40,000 in community contributions raised by the St. George Island Civic Club, and $60,000 in beach park facility funds from the TDC. Project elements include the playground equipment, surfacing, a picnic pavilion, landscaping, and low voltage security lighting. A second fundraising effort was started this past Monday, initiated by one of the Playground Advisory Board members, who encouraged additional donations to the SGI Civic Club to fund a small swing set and one freestanding auditory toy in available space to the west of the playground's pavilion in the site plan. The park's oversized existing swing set will be relocated to another site to be determined within the county before installation of the new equipment. All commencement documentation has been submitted to FDEP, and once the grant amendment is fully executed, which reconciles the project elements outlined in the commencement documentation to the agreement, the county can proceed with issuance of the purchase order. I do have several action items. Letter A, board action to approve and authorize the chairman to sign Amendment 1 to the FERDAP agreement for the SGI playground improvements at Lighthouse Park when available, because we're still waiting on FDEP to get that back to us.
So move.
Okay, we have a motion to approve by Commissioner Ward,
Second.
second by Commissioner Sanders. Any discussion, Commissioners? All in favor? Aye. All opposed? That's unanimous.
Okay, next action item is B. Once the fully executed grant amendment is returned by FDEP, board action to approve issuance of a purchase order for the inclusive playground equipment and surfacing to Rep Services Incorporated for LSI playground equipment based on the Clay County contract pricing.
So moved.
Motion to approve by Commissioner Sanders,
Second with a question.
second by Commissioner Lockley. Go ahead, Commissioner Lockley.
Now, they said they ain't got enough money, but we getting money from the TDC.
We are.
But why we can't go back to the TDC and tell them we need additional money?
Well, actually, with the TDC, there is a limitation each fiscal year for 10% of your sales tax proceeds to be spent on beach park facilities in any given fiscal year. And right now, we have the payments on the SGI bathrooms, which runs about $70-some thousand per year. We also have the $60,000 contribution for the playground in this fiscal year. And then we also have the deficiency in funding for the Carabel Beach Park Pavilion Restoration Project. So that is going to absolutely tap out TDC's beach park facilities funding for this current fiscal year.
Yeah.
And Mr. Chairman, that's per Florida statute,
Yes.
right?
It
We have to
is, it
Follow
is.
those guidelines,
But
unfortunately.
I guess when them people supposed to be here? The senator.
Oh, the end of the month, the 31st.
The 31st is Tuesday the 31st.
All right, put this down just in case I don't be in. Ask them to let these small counties get additional money, because they putting us on a limit, and we not getting the proceeds that the big county get.
To remove the cap.
Yeah.
The chairman knows.
Yeah.
Yeah,
But yeah, we do need to hit them with it again
we
now.
do that,
Yeah.
so.
Yeah, because we're a coastal county.
Yeah,
And we can only spend 10% on the coast. I mean, that don't make no sense.
that don't make no sense. I
Yeah.
mean,
Yeah.
But we'll see
we're a
how it
little
goes.
county, and we got limits on what we can spend it on. That don't make sense.
Yeah, and there's very few small coastal counties, so, you know, we are unique. I mean, it's pretty much us, Gulf County and Wakulla County, and then everyone else has the population or the revenues to justify.
Shoot across the web and see what they doing then.
Well,
But
and-
when we ask for the question.
Yeah, and Commissioner Lockley, most of the other counties that are small coastal counties do not come nowhere near approaching the amount of tourism as an industry that we have.
Yeah, but
I'm
we
sure.
in limbo, we still in limbo, but we get more than them, but we still don't get enough.
We will write it down and mention it to them, sure enough.
Right. Okay.
All right, any more discussion before we vote? We did have a motion, correct?
Yes.
Okay. All in favor?
Aye.
All opposed? That's unanimous.
Okay, Commissioners, and last action item, board action to approve issuance of a separate purchase order pending confirmation of additional community funding for the swing set and additional auditory toy to be located outside the FERDAP project site plan.
So moved.
Have a motion to approve by Commissioner Ward,
Second.
second by Commissioner Sanders and Commissioner Lockley. Any discussion? All in favor?
Aye.
All opposed? That's unanimous.
Okay, Commissioners, and next item is number 6. Board action to authorize the issuance of a manual check to Cook Brothers for the Armory project. The contractor's invoice was mistakenly admitted from the check run approved this morning. That pay request is $153,335.75. It is the contractor's 5th pay request, which will leave a contractual balance of only $8,720 to be processed. And from what we understand, the window repairs were actually completed just this past week, so we believe that project is now completely finished.
So moved.
Motion to approve by Commissioner Ward,
Second.
second by Commissioner Lockley, so we can do this manual check run. Any discussion? All in favor? Aye. All opposed? That's a 5-0 vote.
And item number 7, which is board information, we have miscellaneous project updates. The county projects website, the vendor was finally able to make those changes where the interface now looks similar to what I see. So we will be publishing that on the county website and adding more projects as we go in the next couple of weeks. So look forward to the public being able to use that site, and if there's any suggestions or, you know, anything for improvement that you all see, please let us know. And also for Island View Park, we are also looking for funding to be able to place permanent restrooms in that locations.
Now, is there since it was done, Commissioner Sanders, you know more about this than the rest of us because you were involved in it. Is there anything with the way it was originally funded that we could ask for help with restrooms, or is that completely different?
We will ask them. I did reach out several weeks ago, and they said that they were they didn't have the same amount of money that they did,
Yes, that
you know,
changes
several
from year
years
to
ago.
year.
So,
Yes, okay.
yeah.
Tell them it's going in the
All
water,
about money.
change it.
Well, and to the point, we were having a discussion earlier, Ms. Griffin, with the 10%. So once we get past this year, our 10% outlook changes every year because as we get some stuff paid off or pay for them, then we have that 10% for the next year.
That's
You know
correct.
what I mean?
That's
So
correct.
it might be that we just have to wait till October to try to do something like that.
Yeah, and it's interesting too because beach park facilities, you know, you're limited to that 10% per year. But then when you think of other things, for one, the dune walkovers, they consider that to be a form of erosion control. So it
Yes.
doesn't actually fall into the 10% beach
Yes.
park facility limitation, but
All about location.
it is.
That's about like giving your children $1 and telling them you can't spend but a nickel.
There you go. Well, my daddy always told me not to spend those $2 in one place. But anyway, any Any issues, commissioners, or anything you want to ask Ms. Griffin before we proceed?
One thing, Mr. Chairman, if you don't mind.
Go ahead.
One thing I'd like to look at is, and it's for the future, it's not gonna be like for tomorrow or anything. I'd like to look into what Wakulla County did and how they got all the monies appropriated to them to do all the walk paths along the 98 corridor.
Oh, it's coming our way.
Yeah.
It's coming our way?
Mhm. Yeah, it was a couple of years ago, the board approved them doing the next section that comes into Franklin County
On the Stop Choppy or the Panacea side?
on the Panacea side.
Well, you need one for Stop Choppy side too.
Yep, but coming through, that area, yeah, that's I don't remember the name of it right now, but their plans actually have, when they get through with that, whenever that is, they're gonna have those kind of trails all the way through from Tallahassee, up the coast, all the way to
Are
Pensacola.
you talking about the green, what they call
Sun
the green?
trails. Yeah, greenways and trails,
Greenway.
that's it.
Yeah, the Greenway
Yep.
Trail.
Cause all those are shared use, non-motorized trails.
Mhm.
Supposed to be for walking, bicycling, that kind of thing.
And if you go through Levy County and Dixie County along in there, and even Taylor County, you got a lot of those greenways like that. But I was just wondering on that. Now, when is the deadline? Because it may have changed. When is the deadline for FERDAP grant? So each year.
FERDAP grants, it should be coming up relatively soon. And actually, I was thinking about that too for Island View Park. It may be worth us applying for that because
Is it?
picnicking is actually, if we could somehow essentially tie the restrooms to a picnic pavilion, that may be one way that we can get that funded.
Well, one thing that would be really good right now that we could do without having to go through any kind of grants or anything is get that place mowed off out there. Can we mow the ground? Can we mow it? Because it's head high out there.
Yeah, yeah, that I'm not sure,
Can you mow
Commissioner.
it?
It's
Because,
gonna,
I mean, doesn't the county own that? I know it's got the species of plants they put out there when they
Yeah.
first originally did that, but it looks awful. Looks like
But it was mowed to begin with, because they put those plants, and the only thing that was higher than everything else was the plants they planted.
That's what I'm saying.
So it had a manicured look to begin with.
A little bit of mowing would make it look good.
As long as we don't cut nothing we're not supposed to cut.
yeah. And unfortunately, Hurricane Michael kind of,
Had
2
messed
months
all that
after
up.
everything got planted.
No. Before we move to you, Mr. Rowan, I will say, Commissioner Sanders, and to the rest of the commission, so Mr. Chris Rito, that is the executive director for the ARPC, actually is one of the board members for the Greenways and Trails. We have a meeting Thursday, so I'll ask him specifically about where we are in that project, how long we can expect it to be before we can actually see something in Franklin County.
Because
because
there's a
it's
lot
part
of
that.
people, there's a lot of people that has interest in that.
Oh, yes.
You know.
All right, anything else from Ms. Griffin? You got up pretty easy today, Aaron.
Right.
Mr. Morone, you're up next. Go ahead, sir.
All right, Commissioners, page 12, item A. Last year, the board advertised, received, opened, and accepted a recommendation to award the airport apron rehab project to Pettibone Concrete Construction. Pettibone was the only bidder for this project, but was not able to start until now. The construction contract for the total amount of $1,175,401.75 is funded by 2 FDOT grants and 1 FAA grant, and it's attached for your review and approval. If you approve it today, we send the contract on and they start working on that. And then Commissioner Amos and I will have John Collins of AFCON call you to see, we talked about moving some of the money from stormwater to repair back and forth, whichever way works out. You think we should do it so he can work on that project for you.
All right, pleasure of the board.
So moved.
We have a motion to approve by Commissioner Ward. Was that a second, Mr. Cruz?
Yes, sir.
And a second by Commissioner Amison. I will say, this is just my issue. I should have looked at this better last night. So I started reading this contract. It's pretty lengthy. And then I get to the end of it and I look back and it says that we've already done that, we're just we need the signature. I could have saved myself a lot of time if I'd just read this to begin with. Any other discussion before we vote? All in favor? Aye. All opposed? That's unanimous.
Item B, also attached to my report is the Airport Economic Development Council advertisement that will be posted on the county's website and in the local newspaper if approved today. The language seeking interested volunteers to serve in this council, that was taken mostly from your comments during the December 20th meeting. No, wasn't December 20th? Oh, but there are a couple of things before you guys start discussing it. Two things I thought about afterwards. So, you know, we have the Friends of the Airport. They're not a board-appointed committee in any way, but, you know, look, they like the airport. I would like you guys to consider, as we are when we start appointing members to this board and creating this board, that you make them like a subcommittee, you know, kind of a small core group subcommittee that reports to that board. They don't report to you guys, they report to that board.
Who are we supposed to do that with?
There's a group called the Friends of the Airport.
Pretty big group.
Yeah.
Friends of the Airport.
They just, they like, I mean, Commissioner Amerson been to a couple of their meetings. They have a fondness for the airport, and they have some good ideas about the airport. That's a way for them to be included in this process without actually sitting on the board. It's just food for thought, guys.
Why can't they sit on the board if they submit a?
I mean, they could, but what I'm saying, your board isn't going to be that big.
Oh, no, I understand.
Yeah, so, I was just trying to find the ones that don't get on to be, you know, to be, a way for them to be included in the process, commissioners. That's it. But again, we have time to think about it. The other thing I want you guys to also think about this, I would like that when we do form the board, that Ted, as the airport manager, acts in the same way Courtney acts towards planning and zoning. He sets the agendas. He basically notices the meetings because they need to be noticed properly. That was a problem in the past. And he takes minutes, and we store the official minutes of those meetings here at the courthouse. Again, that was a problem with past airport committees, so that he basically acts like the administrator. I mean, Ted works for this board, but at least he's like a check and balance for us. He's making sure things are going in a process in a way that should be done. And he could report what the board met about. Say when Courtney does a report for P&Z, he could report to the county commission what this committee, this council that you guys create has done.
Ted, all right?
Yeah, I know he's not here. Two things. Well, you know your directors didn't come today, but I'll tell you off.
I was gonna say he don't miss no meeting.
I know.
He's got
he's under the weather.
He's been sick with COVID, but I spoke with him through the weekend. He's doing good.
Yeah. Okay. But anyway, did you guys look at the ad? Do you want to make any changes before I post it?
I would, Mr. Chairman, if you don't mind. I've got a couple things with this. And I was looking at it this morning again. All right, to begin with, you know, my main thing is that
Airport.
Yeah, and that airport, the economic value of it, of creating jobs. But this advertisement and the name is kind of leering away from the actual fact that it's an airport. I mean, we gotta have, you know, the title's fine. If we could just throw in like airport operations and economic development, be fine with me. Okay. But also on the down here, when you start looking at the board members, you know, it's not really prompting that we need some aviation know-how, or, you know, I mean, down here you got airport support, which is a prior airport administrative experience. That could be kind of, you know, offsetting with some people because they may have a ton of knowledge, but they may not have ever actually been, you know, had a job or whatnot employed in that capacity, if that makes sense to you. It just kind of looks like we're getting away from the operational side of the airport. The other problem is having the FBO representative on that board. I would not recommend that, and I'll tell you why. Because that board needs to be giving us input on contracts moving forward with FBO. You don't want somebody that's being affected by the contract to be sitting there making decisions. You follow what I'm saying? I mean, that's kind of...
Yeah, but you do realize that the FBO works for this board?
Yeah, I understand that, but I would like to have our board to have an unbiased, no dog in that fight, so to speak, as regards monetarily.
Yeah.
You know, I mean, if we're negotiating my salary, you don't want me sitting on that board negotiating my salary. You
Yeah.
know what I mean?
And I didn't.
And I'm not saying that I've got a problem with the FBO, but you don't, they don't need to be in that conversation with regards. And I'm not saying we're leaving them excluded from anything, information-wise. They're more than glad to attend a meeting, but I don't think they should have a say-so in that, on that board.
Okay, I hear you, and I'm so sorry, because I misunderstood. When we talked about this on the 20th, we talked a lot about economic development and, you know, what we wanted to do with the board. In addition, the FBO contract, that would usually be reviewed by a specific committee that you create for ad hoc for that. I didn't realize you were going to use this board.
No, I'd like to see this board have
in that
its
manner.
hands in
Okay, that's
all of
fine.
it. I mean, with regard to this, you know, if we have this board, and that's why I like to have, like I stated from the beginning, with business experience and stuff like that, because now you've got a whole different spectrum of opinions. They're looking at a contract. I mean, they may find something that me and Michael don't catch, you know, or have something to add to it, or some type. I'm just trying to get the county the best bang for their buck, so to speak. And the way you do that is you have more minds at it, so, you know, rather than less minds at it, because there may be something that we're not familiar with, somebody on that board may be familiar with, especially in the contract situation as far as dealing with FBOs and so forth. I mean, I'm not an expert with aviation. I don't think anybody here is actually right now that is very much an expert in that particular situation. But if you have some people that have that knowledge, that's had that experience in the past, you know, that's what this board should bring to this commission, and to the airport itself, and to the community, is that knowledge.
Yeah, so just to clarify for me, so I understand better from base, because I listened to the 20th comments, and I looked at the minutes, and this is what you said. I want to make sure now that I'm hearing, you want more of an even split on the board, basically.
I don't know where you got that. I mean, I don't know where you got that, but I mean, yeah, I'd like to see, you know, if anything, if it's a 5-man board, I'd rather see 3 people that have, you know, personally, I'd rather see 3 people that's got aviation knowledge and 2 that's got the business and other aspects of it. Because at the end of the day, it's an airport.
Yeah.
And, you know, if those people know how to get their hands on such and such, it's gonna benefit us, then that's that's who we need to be looking at. This airport needs to thrive, and then we can reap all the other benefits off of it, so to speak, as far as regards to economic development. But if we don't have the airport, a thriving airport, really the other, you know, just ain't gonna carry much weight.
So, just bear with me. So to make it less confusing, do you want 2 separate boards?
No, I want one board.
You want one
I'd
board?
like to see one board. I mean, it's
For economic development and airport
Well, let me ask a question.
management.
Otis,
Yes, ma'am.
could we do the FBO as a non-voting? You see what I'm
Yeah,
saying?
because the reason I add FBO, I kind of looked around at other
I'm just
counties, and
asking.
FBOs are involved in airport board. But if you guys don't want it, that works for me. I was just trying to be as.
But I'm just saying, I can understand where Otis is coming from, or Commissioner Amoson's coming
Yeah.
from, because sometimes the FBO is the problem. So, you know what I'm saying?
Yes, you don't want.
Well, my thing is, you know, like I said, you don't want somebody that's sitting there that's immediately affected
Somebody
on what the
getting hen
decision
house.
that is that has a voting point.
Yeah.
I mean,
Yeah.
I mean, I don't, does everybody understand where I'm coming
Oh,
from?
And I want to be clear. I hear,
Listening, sir.
I hear you now. I'm sorry
you're
where
fine.
where the 20th took me. I kind of
That's why
misunderstand, I guess.
That's why we have these discussions.
Yeah.
But it's just,
So more airport, more just general airport experience members. is
when
what you're
I
looking
see this, Michael, for instance, all I see is that we're looking for some people that just want to get involved in building some businesses out there.
Yeah, basically I was creating an industrial board. That's what I was doing.
But-
Economic development,
But
industrial
what
board.
we need to do is also understand this is an airport and an operating airport.
Oh, yeah.
So that's why we need to, you know, have a good little mix of it. Right now, it's just all kind of lopsided to.
To economic development and
Yeah.
industrial, yeah, you're correct.
But now, just to clarify some things, if we were able to get an MRO at the airport, that's gonna bring the economy and help the airport. You know what I mean? So it's not just, so I would say, just me looking at it, as far as what's on this paper, you could have one resident that lives there, that lives within 2 miles of it. As far as the airport clients, you could have 2 or 3. This could be as many as a 9-member board. I don't think this was meant to just be 5.
No, I just.
There's no numbers here, you know what I'm saying?
Yeah, but I want
Yeah,
to.
but traditionally, we do one per district.
Well,
and I
that's
think
what
a
I'm
bad
saying. That's
idea.
why I just base that number.
Yeah.
I mean, I don't,
Yeah.
we can have a few more. It's not, that's
Right.
fine.
Right.
But it just needs to be, at least 50% of that board needs to be operational, because at the end of the day, it's an airport.
Right.
Yes.
And too, what else you need too, I was just looking at it, marketing, we need, if TDC's gonna be there, let's do the marketing through the TDC.
Oh, so
The
you
mem-
want TDC to be the marketing person, not, or you want an extra person for
No,
marketing?
no, I'm talking about marketing, that's
Can
what
I-
we're gonna be asking the TDC to do, you know, to bring the business in and all
Okay.
that, and market it, kinda.
But see, that's what I was about to say. We're kind of,
We already got that going.
yeah,
But do-
we're already doing that.
Yeah.
With the
that's
site
what I'm
selection.
saying.
But
That's what I'm saying.
I mean, does TDC, I mean, they don't advertise at our airport.
No,
They need to.
Do what now?
They need
They
to.
could.
That's what I'm trying to
We've
bring them
never
on there
advertised it
for.
like, put it in
Yeah,
our
but you need
stuff,
to
but
bring
we could.
everybody in there to where you can put.
Yeah, but when they're landing, they're already here. We're gonna say welcome.
Yeah.
But,
Yeah,
I mean,
but-
Oh, so you can say the same thing about people that are visiting though.
Yeah, I understand
We're
that,
advertising
but-
to
but,
a bunch of people, I assure you.
I mean, I'd rather see us advertise in somebody else's airport than our own. When we get in there.
That's what they're doing.
Yeah.
That's what they're doing.
Well, you know, and we talked about this, I believe on the 20, one of the things I talked about, the reason with TDC and or the chamber being there is the opportunity to create maybe promotions and whatever at the airport, and maybe tap into a set of tourists, visitors, that would fly in for a weekend, basically need some transportation to and from and there. But again, this is y'all's board, just tell me.
Well, do you remember though, do you remember a few years back when the city of Carabel, through the TDC, had the Carabel fly-in?
Yes.
We had the Apalachicola Airport fly-in. There was all kinds of people coming in here like that. That's what I'm saying. You gotta brand it a certain way, and what better than to have promotions and, you know, like that. I'm just saying. And the name, I don't like the name of this either.
Of the council, you mean?
Of the committee.
Okay.
I don't like the name of it.
That's the same name I pitched on the 20th, and, but, I won't say a word. I mean, I
But
won't
we
go
slept
there.
on it. We slept on it for 14 days.
Yeah, I guess.
I
But,
mean, it's all up for
okay, so I want to be clear.
But no, I understand the TDC thing too. I was just pointing out the fact that now we start pulling from everybody that's already got a full-time plate, so to speak.
Yeah.
You know what I mean? If we make it a mandatory, and I don't reckon it is mandatory, because if nobody from the chamber, and there it goes. I mean, if we put this out there, now Solomon's sitting there going,
Oh, he already knows
man,
about
I
it.
ain't got time for this.
Yeah, well.
But I don't wanna make them mad.
So-
Cause you see what I'm
Yeah.
saying? I mean,
You know who's gonna tell you
if
that
he
first
feels as
off?
though, that he could.
He's obligated to
Yeah,
us.
that's,
Yeah,
I
I got
don't want him
you.
to feel like that
That's what I
whenever
was saying.
we have bigger things that he needs to be focused on.
Yeah.
Whenever we could always have a representative from that board go to him and say, hey, look, this is something we're wanting to do.
How do
Can
you
we
feel about it?
You know what I'm saying? I just don't wanna sit there and
Well,
have a bunch of overlap
no.
with our department, so to speak.
And for clarification, I actually mentioned this, but I mentioned it for a temporary time until the county moves forward to whatever it's gonna do with possibly doing like Wakulla County's done and actually hiring somebody to do economic development on our behalf, to kind of run with that and to work more as a consultant, or, you know what I mean? Partial lobbyist, because they're talking and meeting people we don't know. Wakulla County's got a really good turn on their investment in a quick time by hiring somebody versus taking the years to, you know what I mean, to work the ways that everybody knows it in the past.
So,
So if we did that, they could supersede the Chamber of Commerce or the TDC having a spot on that board.
I got you.
Because they're truly more economic development, you know what I mean? So, because I'm the one that mentioned that, I just wanted to clarify
Okay,
that.
so I'm gonna add operations to the title. Do I remove economic development from the council?
No, I'd leave it in.
So airport operations, economic, okay.
Just say
good.
like airport, operations and economical development.
Okay, cool.
Franklin
Make it
County,
about this long.
Apalachicola,
That way-
airport operation.
Well, we're gonna get that thing so long, we're gonna be.
Yeah.
we
Okay.
won't be able to fit it on one line.
Commissioner, I want to be very broad with the airport, the more airport people you want. So just say anyone with airport experience that would like to serve. Could I just add that as a very simple statement as a member? Is that good enough?
I'm good with that, but I still think there needs to be some people that actually rent hangars there, have planes there, fly from there, use there, you know what I mean?
Okay, so I'm gonna leave that in, and then when you guys get the applications, it's for you to review and decide, okay, this one, you know, that'll be a board decision. I'm gonna remove the FBO from the list, okay, and do you want me to remove TDC from the list and leave it on for now, and you make a decision when you get all the applications in?
I would do that, but we just need to let John know that.
I
look,
did.
If you don't get on this board, you know, we don't, you know, I mean, I just don't want to, I mean,
I wasn't gonna say nothing.
everybody's kind of busy. you
Blew
know.
his head off.
When I say that, they're not so busy that they're not going to work, but I just don't want them to feel as though they're inclined to have to do it whenever we can easily just send, or whoever is on this board could go to him and say, hey, look, can we do this or can we do that? I'm quite sure if it's going to benefit TDC, John's going to jump all over it.
Okay.
You know?
Yeah.
Or, you know, if it's going to benefit the county, yeah.
Yeah, he will,
knows the
especially if he could
Yeah,
include it in some of his promotions, I think he really will.
Yes.
But I'll leave it in for now, and you guys decide then, once it's received. Any other changes to it?
So I'll just make a motion that we address that name of Airport Operations and Economic Development Board.
Add more airport experience members?
Yeah.
As a board member, remove the FBO, and I'll just, like I said, I'll just leave TDC now until when you guys get them all in and you decide how you're going to actually make up this board, how many members you'll put on it, because we're not doing that today. We just want people to start sending me cover letters so they could.
I don't think we can possibly pick the number of members till we know how many applicants we have.
Yes.
But it's gonna be somewhere between 7 and 9, is what it looks like.
I second that motion.
All right. So does that help get you where you need to go for today? All right.
A lot better than where it was.
All right, so we did have a motion and a second to proceed with changing the name and rewording some of these
Adding some
things we're
members.
looking for
Yeah.
and adding some.
Yes, sir.
Any more discussion before we vote? Yes. I thought it was Commissioner Anderson, yeah. Not a
I
problem.
made the second.
Yes, you did. Sorry, I thought I stated that, I apologize. All in favor? Aye. All opposed? That's unanimous.
Commissioner Amerson, instead of skipping around, could you just update the board on where my item J, the meeting we had with them about runway 18? Just tell them where we are, removing the NOTAM and all.
You talking about,
You know, the inspection of the runway
Oh.
18 with the removal of the vegetation and how they open back up where we are. And Ted was able to remove the notice to allow people to land on the runway. Just get to give the board a brief update. That's you had a wonderful article in the paper, so that was.
I didn't even see it. What'd I say?
What?
So I didn't see
Usually
it.
I feel when somebody says, look at the paper.
No, basically, we went out with the DOT inspectors. I was just there, to meet and greet. I wasn't trying to strong arm them to open it back up, but we got it. They did a shot. We do have one obstruction that we're working on, but as far as that runway goes, and like they said, and we're working with the states. They're pretty flexible with it. There is one tree. I'm not going to go into details with it, but there's one tree that I need to go speak with somebody about that's keeping that runway. That's a problem. But we're back in business with it. The only thing is like just say, me, I love playing devil's advocate with everything, but worst case scenario, that runway goes to say just a utility runway. still flying them, it's still open for business. I don't understand that one bit, but I do from an insurance aspect. Really all it is that if somebody lands there, gets hurt, or whatever happens, God forbid, the insurance company's got an out. But other than that, if it's utility, it's still wide open. You can use it. However, I guess it's more about use at your own
risk.
Yeah, basically. But the land clearing looks really good. The company did a great job. They were real satisfied with that. We had road department out there with us. We have some, rough terrain there. We talked to Buster about renting some equipment possibly to get that a smoother surface. That way we can put our butterfly equipment, stuff like that, and keep it mowed. I mean, it's, like I told them, we spend this kind of money, let's at least maintain it or make a good attempt to maintain it. One thing I will say, coming back when I was driving in, that fence is, good Lord, it needs sprayed bad. But at some parts now, it's gone to a point now that I don't even think spraying's gonna help it, because it's got a full-grown tree right in the middle of it. But it looked good. FDOT was real pleased. They come back in April to do their full-blown inspection. I'm not gonna tell you I'm gonna go out there for 4 hours, but I'll probably stick my nose in just because I'm interested in it now. I'm starting to see things that I wasn't really privy to before. Inspection went good.
Yep. Cool.
Can I ask a question?
Yes, sir.
That tree you talking about is on private property?
Yes, sir. There's one tree that's, I got a picture of, but there's this one tree that just kind of sticks out like a sore thumb.
With everything else being cut.
Yeah, and I'm sitting there looking, I'm like, really? But, yeah, I didn't even walk down there. I let Ted and them walk down. They were doing their little angle and all that, and as soon as I heard Mr. Commissioner, I said, well, that's not good. But I just told him, I'll shine my flip-flops up and put on a clean shirt and go talk to some people. Smile real big, maybe I can get a chainsaw in there. But no, everything is done perfectly fine. Just that one little, obstacle, but I'm quite sure, given the fact that I know the people, we could probably come to some type of agreement about Mr. Pine Tree. But
good.
Yes, ma'am.
And we did receive the price quote for the rental of the cat bulldozer for the road department, and that would be $9,550. And that's going to be,
How long?
I believe 30 days.
Yep. Can county commissioners drive it?
I can't.
Just saying, I'd love to spend a little time. I can't hear a phone on that. Phone don't ring when you're on track.
So if you all want to proceed with that, we can, give Charlie Usina the thumbs up on this.
Is that something you need to vote for us to do?
That would be great. Yeah, we will pay for it out of airport maintenance funds if
So
that's,
how much was it again?
$9,550.
To be able to rent the equipment to finish the work that they say need to do,
Just smooth it out so we can put that other equipment on there. We just don't have anything that can
That can do that.
maintain it right
Yeah,
now.
that's right.
so.
9550?
Yep,
But that's
9550.
coming, that
From
is
the
coming
airport
out of the
maintenance
airport,
funds.
yes.
Yep,
So move, get it.
yep. And they do have delivery and pickup as well for
Okay,
that.
we have a
Make a
motion to
motion.
approve by Commissioner Lockley.
Make a motion, we get it. If you need it, you got
All right, we have a
to.
second by Commissioner Amison. This was not previously on our agenda, so is there anyone here in the audience that would like to comment on this publicly before we proceed? We are using airport maintenance funds, but again, it was not on our agenda. Seeing none, Mr. Morone, are there any attendees by Zoom?
Yes, there are. Anyone attended by Zoom would like to comment on this? Board action? No hands raised, sir.
All right. All in favor? Aye. All opposed? That's unanimous.
Okay, we'll let Buster know.
Okay, I'll email him right now.
Coming right now, making some notes.
Don't half do the job, let's do it all the way.
Yeah, pretty much. Okay, item C, attached to my report is the final draft of the board meeting policy and procedures for your review and approval. If approved today, the policy will take effect at your next meeting, February 7th.
Mr. Chairman, I'll make a motion to approve this, but with some questions,
All right.
comments.
We have a motion to approve. Do we have a second?
Second.
We have a second by Commissioner Lockley. The motion was made by Commissioner Ward. Please proceed, Commissioner.
In looking at this new policy and procedure, I do like that, you know, our public can speak 5 minutes now instead of 3 minutes. I think it gives them extra time. I'm always about letting the public state their piece. The only thing with that, and I know that we do this to provide and maintain a decorum, but my thing is when they do make a comment, I feel like that we should kind of give them some kind of, I don't know, answer or get back with them so that they feel like that what they're saying, and I know a lot of the things that they say we can't really fix or address, but you know, I do think that sometimes if it's some things that we know or things that we're working on, you know, we should have that kind of banter back and forth between our constituents. So I don't know how that would work. Again, I know we don't want to get into a issue where there's decorum's not going to be maintained, you know, just maybe a back and forth, but that's just my thought personally. And then there was another one.
While you're looking, it does allow in the policy
Okay.
for the board to make a motion to put something on the future agenda.
Okay.
Yes. I was gonna say, I thought it was in there, but I'll make sure it's in directly on the public comments to commissioners, so that in case it's somewhere else, it doesn't get lost between the two spots.
Another thing too, Mr. Chairman, sorry, is
Oh,
the
you-
agenda itself. I do know that, you know, the county staff, it tries to wait for the very last minute to get data or information from another entity to be able to provide information to complete that report. But I personally would like it a little bit sooner than what we currently get, and also provide it to the public so they can look it up online. Because I think what happens is they get the agenda and they get the attachments, say a day or two before the meeting. And I know that once I get everything, I immediately start researching any and everything that I need to look at to be able to make an informed decision. But our public, you know, I think it takes away from them being able to comment, or if they get it too late, then they don't have the opportunity to look at it like we do and come to make a public comment about it or ask questions about it or get with their district commissioner to ask them questions about it or give their take on it. Again, those are just my thoughts, my opinions. I'm one of 5, but those are just what I've looked at with this new policy and procedures that were particular.
If I may.
Yep.
Let me comment on that. So I just to give you a heads up, we have no problem in turning in on Friday what we have, but know that, so we meet today, we don't meet again for 3 weeks. Know that if something comes in on Monday, you're then, the board, if that policy is in place, it's slowing down us taking any action or something like that unless we go through the procedure of how we did today, asking for public comments. The criticism we've gotten in the past with that is that, so you ask for public comments when nobody was here paying attention. You see what I'm saying? So if we add something at the last minute, we get criticized for that because we're saying that you guys just threw that in there. So that's why we got into the practice of uploading it. Like yesterday was, granted it was a holiday and I was the only one here, so I was able to get it up there earlier. We put it up there at the last possible minute in case a contractor gives us information. Even like this morning, Erin was handing, I made copies for you guys, something she got this morning.
And I understand that,
So-
and that's not y'all's fault, but I'm just
Yeah.
thinking, you know, I just feel like it's important that we maintain that transparency with our constituents that may be looking at the agenda online and looking at the attachments that are
Yeah.
attached. That's just my thought.
Yeah, the attachments is not, yeah, you're right, the attachment, well, and I'll say this, Commissioner, because when I put the attachments on there prior to that, people were getting lost in the attachments and they couldn't find our reports. Remember you complaining? So what I did, I actually remove the attachments and say, well, if you need attachments, just contact me. I'll send it to you as a separate email. And so, yeah, I mean, it's, and then our reports, we can put them in on Friday if that's what you got. I have no problem with that, but you'll only get what we have at that point. And then when we want to conduct, if there are other things that come in, how do you want us to handle that? I guess I'm more asking than telling, commissioners, to be very honest with you.
I certainly don't want to delay anything, but I just feel like it's important that people know and are aware too. You know, another thing too is I lost my train of thought
sorry.
here, but the biggest thing is just transparency. I think a lot of people in the public too, and I got this concern. I think it was the minutes. people need to understand that we are not gonna have the minutes until we approve them at the next meeting. So a lot of people say, well, I can't find the minutes. So I just want them to know, and I want to relay to the public that they're not going to be on the agenda for the upcoming meeting, because we have to approve those minutes. So I just want the public to be aware of that.
True that, so.
And Commissioner Ward, and the rest of you as well. So this was something that I've been working on for a little while. Actually started when I first became chairman. And it's not an attempt to put any gotchas in place anywhere, but it's just an attempt to have something actually written down and adopted by this board for how we are conducting our meetings. And most of them are how we're already conducting the meetings. But it gives, for transparency, it gives our residents, our citizens, they can go and look and say, well, this is how they would conduct the meeting. You know, this is what I can expect. This is how the agenda is going to be formed. This is when I can expect to see them. And as far as, you know, the amount of attachments being a transparency issue, I think we're one of the few counties that I've looked at in Florida that provide commission level information to the citizens. Nobody else does that. A couple of counties, they'll put, we're talking about traffic on 98 submitted by John Kane. That's it. That's all you have. So we are about as transparent as we can be with that. And I'm not saying I'm against transparency. I'm just trying to make sure we understand what we're doing. We do a lot of things that are very transparent. And, you know, we continue getting knocked for it, but you can't be more transparent than transparent.
Well, one thing about
You could be like our
trying to
top
look at,
fans.
we trying to,
I said you could, the rest of the citizens could be like our top fans out there, because
Yeah,
those two
there
are
you
in
go.
every meeting.
yeah. But a lot, like, we're giving them 5 minutes now, we're giving them 3. Okay, if you give them 5 minutes, and you got 30 people in here.
Yeah.
Well, if somebody stood up there 5 minutes and talked about something the next 5 gonna talk about, I don't think they should be able to get up there and bring that, they keep on beating a dead dog. You know, we done heard that once, and we understand it. We got it. We don't need it. Just banging it. That ain't gonna make it come or go. I mean, if you hear it one time, you heard it. Everybody grown in here, we know what decision we're gonna make. But sometime that'll happen.
It does. So I would say, sir, if it's okay, and if the board agrees with it, I'm fine with us putting a deadline of when all our materials that we're gonna have for the meeting are gonna be submitted. It might hit us for a month or so, but we'll catch up. You know what I mean? We can try and see how it works. I have no problem with that.
Okay.
You know, if people think we're trying to hide something from them, but you know, if they have questions, they should be asking them.
So let me ask, when you said deadline, do you want to make Friday the day that our reports, and I say our because it's the 3 of us, it's Attorney Schuler, Aaron, and myself, you want to have it Friday, the full report online? Is that what you're asking for?
I think that's what the commissioner is asking for.
Now, my problem with attachments, how do I get them? Because the way it is, it creates a PDF document, and there's no way to move easily through the PDF document, unfortunately. So if I put all the attachments in there, Erin had like her attachments running like 200 or 300 pages. So they would scroll, hit her report, and they'll have to scroll through 300 pages before they get to mine. I had maybe 10 or 20 pages before they would get to his. That frustrates the public.
It does.
So how
I've got a suggestion. Could we, on our website, have a thing for agenda and supporting documents, and they can click on either one of them?
Okay, I'll try.
You know what I mean?
So create a supporting documents link, a separate link.
Yes, sir.
Okay, I'll get with our web.
Let's see if that'll work.
Get
You know
with
what I mean?
Sterling. I'll get with our web people and see if we can do that. But are you asking for a Friday deadline? Is that what I'm hearing?
I mean, I think for the most part, Mr. Chairman, that you guys have your reports ready. I mean, Attorney Schuler's calling me Friday, you know, hey, do you have any issues with my report? you know, for the most part, I think you and Aaron are delayed because, again, y'all are waiting for finality from FDOT or from whoever.
Yeah.
And I get that, and that's not y'all's fault. But I feel like we do need a deadline to give the citizens a chance to go over the agenda items so that if they have a public comment or a concern or question, they can reach out to county staff, to their district commissioner, or whoever. That's my opinion.
And if we're waiting on somebody to give us supporting documents and it don't look like they're gonna get there or they're not gonna be there, then they'll just have to get moved to the next meeting. I mean.
Okay.
I like the idea of Friday. It used to be.
Just out of curiosity.
Yeah.
Yes, sir. I've been quiet because I'm the rookie again, but, okay, y'all turning it in on Monday. So if we back up and turn it in on Friday, why can't you just amend your report Monday?
I could. The criticism we got in the past, and I'll be honest, is that we are changing the agenda like it was some conspiracy that we made changes on the agenda.
Just
that
tell
was
them, go back to January such and such and look at the discussion we had on this. We're not changing nothing. We're just trying to get you
The
information sooner.
that you need, yeah.
But we're gonna have to amend it if we wanna get something done and it comes in late.
Okay.
That's just the bottom line.
That works for me.
And I mean, I don't
That
believe
works for me.
any commissioner up here has a problem with telling anyone that calls and complains about it, hey, look, we're trying to do this where we can get you more information.
Because we've had complaints about the
yes.
agenda being put out too.
Yes. But
too late.
what I could do is continue to keep it in a draft status on Friday with as much information as possible, and then Monday, remove that draft status when I think we have everything and just make whatever changes were there. So they realize there might be a change between what they see Friday and what they see Monday. That works?
I think that's good. And Mr. Chairman, like I said before, I like to research everything that I'm making a decision on. And I've even told y'all before, when I get the report at 9 o'clock at night, all right, well, be prepared to get a call at 9 o'clock at night if I've got a question. It just gives me an opportunity, and I'm not speaking on behalf of the commissioners, to call people, call the people that are involved, call you, call Aaron, call whoever, call Attorney Schuler, and do my investigation. If I have to call somebody that's not even county staff, just calling somebody, say at FDOT, well, hey, this is coming up on the agenda, what, can you elaborate on what it is? Or whoever the case may be. I don't want to be calling them Monday, day before the meeting, trying to be able to make an informed decision on something that I'm making a decision that, benefits the citizens of Franklin County or affects the citizens of my district and or Franklin County. That's my point.
Okay, we're good. I think it'll take me longer to figure out the separate link for the attachment, but we have fortunately we have a couple of weeks. And what I would ask, since we're doing that, could we just table this until we get all this worked out to make sure you guys are good with it?
I will amend my motion originally to table this.
Thank you.
Amend the second.
All right. The motion and the second have been amended.
It just take time.
To table. I will say before we go there, just some discussion, Michael, under the citizens input part on page 9, there were a couple of notes that were left in. That I think was stuff we were passing back and forth, all of us, and talking about stuff. So it says, one of them is a note how this would be changing from something we've done before. The other one, I think, needs to be added as a sentence, the last one. It doesn't need to be a note, but on workshops, we're looking at citizen input to be one comment period. Because we have had workshops where we say something and then somebody else says something and then they say something, well, the first person was talking.
Yeah.
It just delays everything, because most of the time, like Commissioner Lockley highlighted earlier, they're just repeating what somebody else said, well, I agree with that too,
Yeah.
That just,
Okay.
anyway.
We'll fix that.
There's some couple of editing notes that were left in.
Okay.
People know, it's like this. We keep everything in the open, and they ain't gonna find nothing. Nobody trying to hide nothing. They just trying to find some boogers. I don't worry about it. It'll stop.
Good. But no.
It'll go away.
Commissioner Ward, we try until we get as close to getting it right as possible, best we can do.
Anything else to discuss before we take this vote to table? All in favor? Aye. All opposed? That's unanimous.
All right, Commissioners, on D, at your last meeting, one of the items discussed during the Commissioner's Statement of Intentions agenda item was to proceed with hiring a code enforcement officer. I asked Mr. Patterson and Ms. Bankson They're your complaint department right now, to provide a list of complaints received over the last year. I think they went back a little further than that. So basically on the list, you had 8 RV complaints, 6 unauthorized land use complaints, 4 for trash, 3 for land clearing and fill. In addition, there were 13 building department related complaints, but that doesn't apply to your code enforcement officer. That's what your building official and inspector, that's what their job is. And there were 9 turtle lighting complaints. Well, the turtle lighting ordinance, the county is not enforcement. We have an administrative role. So we pass that on to the sheriff or FWC, depending on what it is. So my recommendation is that this list of complaints, excluding the building departments and turtle lighting, is forwarded to Attorney Schuler so that he can verify that there is an ordinance in place to address these issues and that the language for any pre-existing ordinance is current and has adequate penalties for the violations. During your discussion of this item, you may want to add other items to the list. I'm just trying to keep the horse ahead of the cart here, make sure we have a solid code of ordinances to enforce, and then, as we go after the code enforcement officer. And that's more for discussion than it is for action, to be honest. If you guys have other ideas that you want to do it the other way, get the officer in and let him tell us what's wrong, that works for me too.
So based on these numbers, Mr. Chairman, can I speak?
Yep.
Based on these numbers, you're gonna be paying a woman a whole lot of money to do nothing. Cause it ain't enough complaints in there. Keep nobody busy, not for those years. I don't think they can do this with these complaints. You can work these out in 2 weeks. A month.
So
here we are.
Mr.
Okay, I'm sorry.
Mr. Chairman, I will say this. For example, the land clearing and fill, and I'm sure other commissioners have gotten this phone call. Some people are getting calls when they're clearing their land and having to come to get a permit, and others are being told they don't have to have a permit. And so what's happening is there is no continuity, there's no consistency, and I don't like that. If we are not going to enforce certain things, then we need to eliminate the ordinance or eliminate the permit, whatever the case may be, until we can, me personally with the land, and I've talked to Steve about this, and I talked to Attorney Schuler about this, the land clearing and fill, if we're not gonna be enforcing people to come get a permit to clear the property, then we don't need to have that as a permit.
A requirement for a permit.
I mean, obviously people know that if you're gonna be building a home, it goes to know that you're gonna have to clear the property. Now, I understand that we have to be careful because we do live in a critically shoreline area with, animals and such, but the fact of the matter remains, what's good for somebody that's not good for someone else? So, I feel like that, me personally, and I was actually gonna bring it up in commissioner comments, but I'm glad you brought it up in your report, that we need to potentially eliminate this right now. I'm not, of course, taking action today, but just something we need to think about. Eliminate this and then come back later, change the verbiage until we do get someone that's gonna be able to enforce it. Maybe put, X amount of field dirt, have it to where it's actually specific and it's pretty easy to understand and enforce it. If we're not gonna enforce it, we don't need to have it. That's my thing. But I do think that we do have a lot of ordinances on the book, but a lot of these ordinances may be back from 1982. Well, 1982, I'm just throwing that date out there. 1982 Franklin County is not 2023 Franklin County. So there may need to be some verbiage changed in the ordinances that we've discussed, and maybe more, that are gonna affect how this code enforcement officer or whoever enforces this complaint. We've got a lot of good ordinances and laws on the book. We just need to enforce them, but we need to make sure that they're enforceable by having the right verbiage on them. That's just my take. But the land clearing and fill, I think we just need to eliminate that altogether for the moment until we can get it to where it's consistent and get the verbiage changed to accommodate what we need in our county.
Can I say something?
You can.
On something like, I agree, okay, but it's a way you can beat this. They got to get a permit in the beginning, right? So you put on that permit. If you're not doing the right thing, we come and pull your permit. That gonna stop a lot of this. But the code enforcement and that, hey, you ain't doing what you supposed to do. You know, if they supposed to clear the lane, and they not doing it, and it's on that permit what we gave them, go out there and snatch that permit. Send the man out there and take that permit down. Stop work on it.
Commissioner Lockley, I think, Mr. Chairman, the problem is right now, the building permit's not, say if somebody comes and pulls land clearing permit.
Yeah.
They're not enforcing that. Like, they're not going out looking at, because let's face it, he's got other things to do better with his time. But what I have neighbor A that states that they don't need one, and we're told that they don't need one because they're not enforcing it. But then I've got neighbor B over here that's clearing his property, and neighbor C complaining that the property's being cleared and that they have to come get a permit. That's my problem. There's no consistency. If you're gonna require a permit, you need to require a permit for everybody and enforce it so that there's no confusion as to, well, I was told you had to have one and got one, but then I was told that you didn't have to have one and didn't get one. That's the issue.
Well, what we need to do is hire Blue, like the city had Blue.
That's what we're talking about, code enforcement.
And let it, he go around and he do that job 2 or 3 times, people know he gonna do it.
And that's my point, is to get rid of this until we have somebody that can do that. That's my thing.
Well, I thought that's what we're trying to do with hiring code enforcement.
Yeah, right.
So
Blue went out there and showed them that big badge.
I will be able to say, though, I personally could never support doing away with this requirement. We already have a problem with this, and if we do away with it, it's gonna get worse. And it might get worse in other areas of the county, but I know for a fact it'll get worse in my district. It is a problem. So, because, you know, there are all kinds of things being done. When we get further into this code enforcement stuff, it might not seem related, and we're gonna have to do it. It should have been done decades ago. This county needs to look at a business license. I don't care if it's $25 a year. Because when you talk about these landfill permits, we can talk about all of us as neighbors, and I have to have one, and you don't, but you do. That's one thing, but it's another thing when you have people that are running businesses that never get a permit to clear. So we're gonna have to look at a business license for more reasons than that. But there's no way I could ever vote to do away with land clearing being a requirement, or having a permit for land clearing and or adding field. Because the bigger issue I have in my district specifically is they'll do all the permit stuff, we'll do all the P, Z, and A stuff, but then when they get there, they do what they want to. Because we don't have proper code enforcement. Now, I do agree that that's maybe a little bit more than Steve can handle. This should give us even more of a understanding of just how imminent this issue is for us. And yeah, these numbers are small, but we just started doing the complaint website. Some people don't even know we have that website yet. And I can say another one that's not on here that I get constant complaints about is people using the county's right of way. I had a call this weekend, somebody is taking a tractor and the county's right of way is hiring their property where they move dirt off the county right of way onto their property. If we do away with this requirement, that's going to get worse. That's not going to get better. Because now we flip the switch to off. You know, that's my only take with that. Then everybody knows, well, it doesn't really matter. We can do what we want to, for sure. And then nobody's asking about nothing.
Well, Mr. Chairman, then if that's the case, we need to make sure that everybody needs to get one.
Oh, yes.
And then we need to
I
start
agree with
enforcing
that.
it. Because I don't want to, you know, it's not fair for one and not the other. That's my
Oh, that's true.
take.
Yeah.
I mean, I agree with you. I see your point, but we're going to have to start enforcing it, and we're going to start requiring everybody to get one, period.
If I could go back to what Commissioner Lockley said earlier about the numbers being low. Keep in mind, the state passed legislation here recently about you can't be anonymous anymore.
That's right.
That's what has kept our numbers low, because before people just used to call and say, my neighbor, blah, blah, blah. Now they have to leave their name, they have to leave contact information. They're not too willing to do that. What we need to be careful with is I don't want this, and Attorney Schuler is going to word this way better than I can. I don't want him using you guys kind of a backdoor way to get complaints in. That's.
And that's what's happening.
Yes, I'm not really comfortable with that, because I don't want us to get blamed for not following the state requirement that the person who made the complaint originally have to leave their name and number and contact information. I'm a little worried about that, Commissioner. But, again, this is a recommendation for a procedure. If we want to change this and concurrently start the two at the same time, the process of, and then my next question is going to be, are we looking at an employer, or do you want to start off with regard for RFQs to see what firms offer code enforcement and start that way to see how it works? And then down the road, you could decide if you want an employee or not, or you want to go headstrong and get an employee to be a code enforcement, like a blue, Commissioner Lockley, that you were talking about. Is that, I need to know too, which way the board wants to go with
Mr.
that.
Chairman, I'll make a comment on that one. I think that, personally, I think that it would be in our best interest to start out maybe as a subcontractor, because if you think of it in the terms of, if we hire somebody, who are we gonna hire? Is it gonna be, I don't want it to be employee of the administrative of the board. I want it to be the sheriff's office or someone else. That's me personally. If you hire someone, you're gonna have to pay their salary, you're gonna have to pay their insurance, you're gonna have to pay their retirement, speaking from the county's perspective. So we may spend way more money doing it that way than just subcontracting it out. And they can start out full-time, and then if we have to go part-time, we can. And then if we come to the point where, that way we're not having to eliminate an employee in the future or eliminate their hours when they were hired on at a salary for X amount of days, whatever. That's just my opinion. You know what the rest of the board feels like?
If I could ask, that was something I was gonna ask a moment ago, is right now, if we have a code issue, we have to call the sheriff's department, correct? Are they the ones that enforce it? I mean, because we have no enforcing agency right now, do we?
No,
It's so confusing.
Yeah.
Go ahead, please, I'm just.
No, it's him.
And please start off with the whole email.
He's the one that sends the letters.
If you would, Attorney Schuler, if you don't mind.
The current system is basically ad hoc, Commissioner Amison, there was no particular board action that says step 1, step 2, steps 3, but over the years, what's essentially happened is your administrative staff here handles the complaints as best they can, and they do a wonderful job of resolving most of the complaints. At some point, staff reaches a level of frustration in their attempts, and then they unleash the lawyer on people, and people get sued eventually, which is not necessarily a good mechanism for enforcement either, because the court system grinds, it's slow, and most commissioners are going to want a very timely response to a complaint that you have received. And the court system is just not geared to have that kind of a quick response time, which is why you're at code enforcement now. So again, staff is usually the first step. I mean, occasionally people call me directly and I will say, no, it doesn't work that way. You need to talk to the county staff first. They will handle it in-house, and then when they get to a point where they can't resolve it, then they get it referred over to my office, which occasionally does result in litigation. Usually when people start getting letters from lawyers, they tend to, for better or worse, respond more so than they do to non-attorney letters from staff. But code enforcement, when people start racking up $250 a day fines, it will get their attention.
Well, what's gonna be the difference if we hire a code enforcement guy? He's just gonna be sitting in here getting a phone call, and then he's gonna have to call you, right? I mean,
not with
they have some type of legal.
No, we've hired somebody to hear those cases. Okay. We've already hired a magistrate.
Right, there will be a magistrate. There's a process, and again, as I explained to the board a couple of meetings ago, the flexibility I have built into your code enforcement ordinance is this board will retain the discretion that if you think an offense or violation is egregious enough, you still can go through, say, the second-degree misdemeanor penalty. You can still go to court and sue them, or you can exercise the code enforcement. I would suspect the vast majority of enforcements will go through code enforcement and through the special magistrate system. But I have retained the flexibility so this board can decide to do other types of enforcement as you deem necessary based on whatever circumstances you're facing in the future.
And Mr. Chairman, Commissioner Amison, a lot of times, like I've got right now a code enforcement complaint that the health department's involved with, so it may not just be the county staff. When it becomes a health hazard or issue, then the health department can also get involved. And there's also a nuisance and abatement law that they also have, that you can, that's where the sheriff's department, I think, is coming into play, is the nuisance and abatement, but.
Mr. Chairman, if I may, Commissioner Amison, I think one of the thought processes from the public is if you hire a code enforcement officer, he's gonna be like a deputy. He's gonna make regular rounds and patrols, so maybe they won't have to call in. He'll catch it on his round and see it. So I think there's an expectation there. There's a difference between waiting for a complaint and have somebody out there actively looking for violations. I've heard, we went through all those workshops. We had a public workshop here. I think there's a public expectation of that, sir.
Mr. Morone, on some of the complaints that we have received, say for instance, like the one particularly with the turtle lighting, this board is more administrative in function for that, or the county is. Do you know if all those have been resolved? They were sheriff department.
Yeah, I don't know. That's a question I'd have to ask maybe Courtney, because once it's handed off, I don't know. Sometimes it's handed off to FWC, and you know, well, it gets complicated with where the light is exactly to the, what is that line again, sir?
Excuse me?
Where's that line?
Coastal construction.
Coastal construction line. It's where the light is compared to that. So most people, you know, Commissioner Amison said he needs to go to the beach more often to see what's going on. Most people don't even know where that line is, place to place that they go to. So they have to know where that line is to understand these lights may not be in violation.
Okay.
But I can check on that for you, sir.
No, that's fine.
Ain't none of them in violation for me.
I hear you. I hear you.
So, do you have what you need from us, or do you need an action from us?
I'm so sorry, but not really. Do you want me to put it in more of an action format in my next report, next meeting's report?
Well, I mean, I guess the biggest question, Mr. Chairman, is, are we looking more towards subcontracting this out or hiring an employee, or?
I would be in favor of being a contractor.
So that's the first question we need to
For
probably answer.
RFQs,
Yeah.
I would be in favor of doing that.
So I'll add that to my next report. I'll add that. What about, do that. What about the list? Are we going to, do you want Attorney Schuler to handle them as he gets them? Because we could take that approach too. We can do that rather than him having to sit there and go through all the ordinances and, you know, make a judgment call. I mean.
Well, I think, Mr. Chairman, sorry, the biggest thing is the RV, which we've discussed in the past. That's the most popular complaint. Of course, the unauthorized land use. One of the complaints I have right now is trash in a yard. That's the health department's involved in that violation. So, yeah, I think all this is a good start in terms of revisiting the ordinances. I don't know what other commissioners' complaints are.
Yeah. Well, land clearing and field, though, really isn't a code enforcement thing, though. It's more of a building department thing, land clearing and field. That falls in, they have to get the permit from the building department.
Well, some do and some don't.
Well,
they're supposed to, but.
I don't want to speak to Steve, and he's not here today because he's sick. He planned to be here. I'm not sure if the state building code statute actually speaks to land clearing, and I really don't want to say something that I'm not.
Our code does, Mike. We have a specific provision.
Yeah, but would that make it a code enforcement thing or building official thing to enforce? I think that's what the.
That's what I'm trying to ask, is which way
Yeah.
would that go?
If it's our code, then that's a code enforcement officer, correct?
It can be, yeah.
Okay.
And, might as well throw in right-of-way complaints, because I get them at least a couple a day.
I guess whatever we do, long as they get somebody who gonna produce and do the job, we'll be all right. Enforce it. We get them, whoever it be, make sure they enforce it. But they don't.
All right, so my notes say I'm basically going to have an action item for RFQ for code enforcement at the next meeting. I'll actually start working on that RFQ, that ad from now.
Mr. Chairman, just one more note to add about the subcontractor versus an employee of the county. There are certifications that are involved when you're when you are a code enforcement officer. These people should already have that in place versus we having to send them to school or pay for their certifications, et cetera. Right.
That's what I was curious about,
Yes.
what kind of training certification it would take to.
Yes.
Yeah. Okay, think I got it. If not, I'll call you all individually. Okay, item E. Another item we discussed at the last meeting was the redesignation of certain private roads to county roads. As there are public county roads that need maintenance and perhaps paving, I recommend that the county engage an engineer, and I don't know if Dewberry can do this, I have not checked, that can inventory all your county roads and provide an estimate of what it would cost to have those roads upgraded to an acceptable standard, which may include paving. Then, provide that engineer with a list of private roads that the board would consider accepting as public county roads and request an estimated cost to have those roads upgraded to an acceptable standard. With that information, the board could then proceed with designating a funding source for this project. We've got to find money before we even tackle it. Sir?
I got some good news, bad news about this. So, the good news is, that's part of what the ARPC is planning on doing with our regional transportation planning agency that we're still getting underway. The holdup so far has been DOT. That's one of the things they're gonna have as an action item on their list for all their member counties is having all our roads surveyed and knowing what where they're at, what you would, just exactly what you're talking about what it would take to get them up to an acceptable standard, which may include paving. That's part of the task that it's gonna undertake. At least that's what I've been told by Mr. Rito, having input with that.
Okay.
The bad thing is, we still have not gotten completely there yet because of hold up with DOT and some of the language and what they're doing, because this is under their umbrella, because it's a regional transportation planning agency, but they don't want to call it that. They want to be called something else. So anyway, but it might save us some dollars. Again, it won't be able to happen quickly, but that is part of what it's going to be doing as an entity. Now, we could always do ours and make it easier. I'm not trying to say we have to delay for anything, but that is something that's already on the list of to-do projects for all the member counties.
And they'll do it at no cost to the county?
Well, they're gonna be doing it through grants. It will not cost the county anything.
Okay, Commissioner, so what do y'all think?
That has to do with public roads, county though, not private, right?
It does, it does.
It does include private roads?
No, they include all the roads when they start doing it.
It includes all the roads?
Yeah,
Oh,
we'll
okay.
include
Well,
all the
then
roads.
I'll
Now,
just
the
say-
issue would be when you still have, and it's just gonna be the issue that people are gonna bring up, when you still have county roads that are not up to an acceptable standard, well, how are you gonna accept roads that aren't yours and bring them up to a standard? You know what I mean? That's gonna be an issue.
I say if the PRC's gonna do this, we just let them spend their money, not our money. That's
Well,
my
not only
take.
money, they're gonna be doing the work too.
Well, there you go. And
So-
then if we don't like what they're doing, then we can
Yes,
come back and
you always
revisit
have
it
that
later.
option.
Okay, so we're gonna wait to hear from
And I
you.
should have an update for that Thursday we're meeting.
Okay.
Sorry, wasn't trying to cut you off.
And on some of those private roads, they want the county to maintain it, but they still want it to be private. So you're not gonna be able to do that if county.
Oh, no, yeah.
Can't do
Yeah,
both.
you can't have it both ways. You're right, Commissioner. Yeah, you can't have it both ways. Okay, so for that, I'll put a note. We're gonna wait for ARPC and see how their project works out.
Yeah, 'cause you get that private road fixed up, and then so there's too many people driving on it. Oh, we need to have where only locals can drive here. That don't work on county road.
True.
That'll never work.
Okay, Commissioners, item F. Another matter has been discussed at recent meetings is a new permanent location for Supervisor of Elections Office. Commissioner Lockley has said this numerous times. Chairman Jones, I think you said it at last meeting. The board is aware. Yes, you did too. I'm sorry, I apologize. The availability of property in Franklin County is at a premium. We just need some direction. I mean, every so often I'll walk into Erin's office, I say, okay, tell me what's available. And
What does she want? Or what is she saying about?
she needs somewhere secure because she needs a better building where the roof doesn't leak, the AC doesn't go out, but she needs to secure her servers. That's one of the most important things, and the office. I haven't had discussions past that with Honorable Ms. Riley.
So, Mr. Griffin, didn't we set aside money from our ARPA funds for this purpose?
We did. Yep, yeah, let me get
So I
you
don't know the
the,
process we need to go through, but I have located a potential seller of property in East Point that is in a area that we can build on the ground floor, so to speak. I don't know what the correct terminology is, but we won't have to build up off the ground. It's not in a flood zone, nothing like that. But I don't know what the process would be to bring that forward. But it's about almost 6 acres of property.
Mr. Chair, I'm glad you said that, because I've heard people say, well, knock down the old jail, or we do have property ready, we're in the flood zone.
You can't
So
do that.
it's kind of rough to put a
Public
public
building.
building
Handicap
with ADA
accessible.
accessibility.
Yeah.
It's like 8, 9 stories. The bottom floor starts, 8, 9 feet up in the air. That's not gonna work, Commissioners.
we have approximately $734,205 in our American Rescue Plan draft spending plan
Okay.
for additional office space.
Well, maybe we can do it on the next meeting, but they do have an amount, and it's well below that they potentially would look at it. But I did tell the property owner that we would have to go through the process, turning the shoulder like we do with other properties we've done, where there's an appraisal done, the appraisal has to come back at an amount, that kind of deal. But, so I guess is it something we can just add to the next agenda for
I will.
discussion? And I'll give you more of the details.
So, I'm sorry. I guess it's getting late. So I'm adding that we are going to go out officially for appraisal for this property,
Yes.
but, okay.
Yep. To get the board to vote
Let me
on.
ask you a question.
Yes, sir.
Don't we own that prison out there? All that land?
The old work camp?
Let's go work camp.
That is actually, and Commissioner Emerson has gotten a good education on this, that's actually county airport property. That's restricted as what we can use it for.
To add to the economic value of
Yeah.
No, it's trying to figure this out.
It's different, for sure.
But the FAA has a regulation that you can't, and me and Mike will talk about this, he may be able to law this up a little better than me, but right now, you can't use the property unless it's aviation related. Am I right here? We talked about it too.
Aviation related, and you also have to charge fair market value for rental of the property, so that's kind of something where we.
But beauty is in the eye of the beholder. I figured that out too.
The governor flies.
Do what now?
So
This aviation related, the governor flying here sometime. Yes, he on the other end.
Oh, he does, he uses the airport, but Heather, we will have to justify how the supervisor election is aviation related.
I think there's a loophole. We just gotta find it. I mean, honestly, because I've been around other airports, not on other airport property, and I've seen stuff that wouldn't directly, I guess we gotta get creative and figure it out.
Now, I don't know if they're able to use it, but I noticed last night on some of the stuff Ms. Aaron sent us, the economic development plan for Ormond Beach. It shows a picture of their airport, and there's a sports complex right off the end of the runways. How does that work? So,
Sometimes it's better to ask for forgiveness.
just saying. So does that get you where you need for this item, sir?
I guess approval for the.
Or is there any other discussion?
An
Any other
appraisal.
commissioners have
And
discussion
Commissioner
about it?
Emerson, just, I know, God, you guys have another 1:30. Don't forget, John kind of told us we could also start the process of trying to remove that property from under county airport owned. But again, we have to pay fair market value to get any property we would want to move. It all depends if it's in a zone, a landing zone, a takeoff zone, that has a lot to do with whether or not they'll let the property go
You talking
to.
about that outside the fence?
Yes. I was talking about the work camp, I'm sorry. I was still at the work camp. I'm so
Oh.
sorry. I thought that's
But the
what.
state gave it to Franklin County, they didn't give it to the
Franklin
airport.
County gave it to the state, and the state gave it back to Franklin
That's
County.
what I'm saying.
With stipulations.
They ain't said nothing about the airport.
They just went back to where it was before, because it was airport property prior to when the county gave it to the state, if I'm not mistaken.
Yep.
So it came back in the same fashion as it went out.
Okay, well, we'll send it back, tell them to take that off.
Look,
I'll have that as an action item on my next.
anyone else have any thoughts about it or different property or different situations before we move on?
I think we're gonna discuss it more at the next meeting.
Oh, I'm sure we
Okay.
are, yes, ma'am.
I'll save it for them,
Okay.
since we're really short on time.
Burning daylight
All right.
got one.
Okay.
Go ahead, Mr. Rowe.
Quickly, there's, everything else is information, stuff, commissioners. I mean, we could, Chairman Jones, we could discuss the Duke site readiness. We've kind of beat that down already for the most part, talking
Yes.
about the airport and stuff. There's the senior update.
I want you to give that in public so that people have got it.
Okay, so item
Update
G,
on it.
last week, Ms. Bretz, Lisa Bretz, she called and provided an update on the closing of the Garden Club building used as a congregate site for Carabel seniors. Her staff and attorney are reviewing the deed for the Garden Club building to decide who they can transfer, AAA's Area Agency on Aging, who they can transfer ownership of the building to. In addition, they're verifying that all seniors that receive services prior to the closing of the Garden Club, either at the congregate site or at home, that's a typo, they have been contacted and provided phone numbers and names in case those seniors have questions or need additional services. I'll stop there and say, yes, she admitted that there was an issue. Some seniors were not contacted. Let me just say this.
Some still have not been.
So yes, so they're working through Liberty County, who she said here, well, virtually, that, Liberty County is the responsible contractor. So she's having them go over all their paperwork and make sure every single senior that provides services was contacted. And she's also gonna send me those numbers, and I'll forward those to you guys, okay? And in addition, she's also gonna give me the information. I gotta respond back to her. Cause you guys wanna appoint a representative on that board, so you have, Franklin County has representation, so you guys might be able to appoint that at the next meeting.
Well, the people getting served now?
Mm-hmm.
They getting served?
Most,
Some of them's not getting started.
I think there's one or two that kind of fell through the cracks, to be very honest with you, Commissioner Lockley.
That ain't good.
Yes.
And Mr. Chairman, just so that the public is aware, they really can't, I believe their meeting is in February, so they will have a meeting to determine, once this is all, they're investigating who the congregate site building can go to, which is a nonprofit, or I think it's a 301c
Yeah.
nonprofit, or, which would be the county or the city, but they won't be able to actually decide this until their board meeting, because they have a board of directors, which isn't until February, unfortunately. So we're still working on it, and we're still, updating it and actively pursuing it. It's just a matter of, they have to decide with their board who the building goes to, and that's in February, is their meeting, I think, their next board meeting.
Okay. And I attached the ad of the building inspector advertisement. Legislative delegation is the Tuesday the 31st, in here at 11 a.m. Your next meeting, you have one this afternoon at 1:30. I apologize, I thought today we would get out earlier for sure. That didn't work out. And your next regular meeting is on February 7th.
Mr. Roan, before we wrap up, the only thing I'll say about the site readiness stuff that we continue the discussions we're having. So Duke Energy Site Selection Group is acting like they are all in. They're gonna help Franklin County to possibly put forward a, maybe not joint, but as close as it can be to joint, an application in with Triumph to try to get dollars to start putting some infrastructure in, to the property that we own outside the airport fence, to start trying to, because they said the closer they can get it to shovel ready or ready for somebody to move in, the more likely they are to help us find tenants and some kind of economic development around the airport, so. That still has to go through Triumph, it still has to be approved, it's a long process. They're just proving the fact that they are what they said they are when she was here in front of you, in front of this board. They are not just trying to give lip service toward it, they're all in, they want to try to help with the economic development of Franklin County. Anyone else have anything for Mr. Morone?
I've got one item. The football boys that were here and some of the teams that didn't show up here, because they didn't win. They want to hold a football banquet, but there's nothing big enough in here, like East Point, Carabel, it's nothing big enough because it's 140 kids plus adults. Is there something we can do with the Armory to help them with the Armory or
Yeah,
not?
the Armory's good to go. Just actually, Commissioner Fonda is now in charge of renting the Armory, so just
Okay.
have them contact Fonda. That's the easy fix.
Okay.
And they have kind of a loose loose calendar because he had that fundraiser you guys approved.
Yeah.
We have Chef Sampler coming
I
up.
don't know
but
when
it-
they'd be able to have it,
and
but.
something else, but
They should be able to coordinate it though with.
Yeah?
Because there's a calendar that Fonda has. All right. Anything else from
When they
Mr.
gonna
Moore?
have a walkthrough for that?
a walkthrough,
Yeah.
like you want a grant, like a grand
Yeah.
reopening? Is that what you're asking for?
Yeah, just let us walk through and look at it. I just wanna walk through.
Oh, you can, I mean,
Yeah, we can arrange that anytime,
But I
Commissioner.
just like to go-
Yeah.
I can go get Keith from somewhere.
oh yeah, we can,
Yeah, Mark can take you.
really?
Yeah.
We could actually leave it, yes, Mark can take you, or we could I could just, Fonda will have Susie leave it open when you want to go in, sir, and you
I
can.
think it would be a good public, opportunity though, a good publicity, to have the board go through there and everything.
See, we'll have like a little event.
Yeah,
Okay.
yeah, and have,
Like a soft reopening.
yeah, South Korea, and have
Ice
some-
cream cake.
yeah, and have something. Because, I mean, that's been a long, long time waiting.
Come on.
Huh? Yeah, possibly. Main menu.
Is that it for you, Mr. Merle?
Yeah, that's it for me.
Colonel Stewart, we're up to you, sir.
All right, two action items on my report, Commissioners. The hour is late, so I'll be very brief. Attached to my report is a certificate of attendance and authority for the mediation in some pending litigation between HLS versus Franklin County, which you may remember as being the RV Park Development Application litigation. This certificate authorizes Mr. Morone and myself to appear at the mediation on January the 27th. It gives us authority to negotiate on behalf of Franklin County. And if we can agree on a recommended settlement, we will come back to this board with a recommended settlement, which you would then consider in some future date. But Mr. Morone and I would not have any final settlement authority. And what I'm specifically asking for today is for the board to ratify and approve the county certificate of attendance and authority in the case that I mentioned, because it has already been filed with the court last week in order to comply with the deadlines prior to mediation.
Pleasure of the board.
So moved.
Motion to approve by
Second.
Commissioner Ward, second by Commissioner Sanders. We're gonna put you guys in attendance. That's what we're voting for. Any discussion before we vote? All in favor? Aye. All opposed? That's unanimous. You are authorized.
The next item is a proposed Walmart opioid settlement sign-on request from the Attorney General. I say a proposed settlement because they've set a deadline for non-participating counties such as Franklin County of March the 18th. The participating counties in the litigations, their deadline to sign on was back in November. And until the deadline in March occurs and the Attorney General sees how many counties are actually participating, they will then make a final decision whether to finalize the settlement. I looked at the email that had been sent to the chairman that he forwarded to me. I could not find the document which gives me the number potentially that the county would receive in the opioid settlement, or the proposed opioid settlement with Walmart. I went to the Attorney General's website. I couldn't find it in their website documents either. So I can't tell you what the number is, but it's going to be more than zero, and it's money we never would have gotten for opioid relief anyway. So my recommendation is that the board approve and authorize the chairman to fill out the sign-on request, send that on to the Attorney General, and at some point I'll report back with future information as to what the amount is once we receive that information from the Attorney General.
So moved with question.
Here we have a motion to approve by Commissioner Ward.
My question is, it says, obviously, this money, whatever we get, whether it be 0, 500,000, whatever, has to go to opioid abatement. Is that the specific purpose for getting the Narcan distributed within the county, or education, or I guess you probably don't know the answer?
The Narcan distribution was mentioned in the information provided by the Attorney General's office and their website, but there's not a lot of detail I can provide the commissioners at this point, other than the Attorney General's asking for us to sign on, and then we'll get more information, I guess, in the future. But what would happen is if we sign on and they do finalize the settlement, then we would be bound by whatever terms that are agreed to by the state of Florida and the Attorney General. But we've signed on to several of these already with other, like, I think it was CVS, Walgreens, and some other opioid settlements. So this is just, more money going into the pot that could potentially benefit the citizens of the county in the abatement of the opioid crisis. So what I'm asking for today again is authority or for the board approval of the sign-on agreement and for the chairman to sign that agreement.
So we have a motion to approve by Commissioner Ward,
Second.
second by Commissioner Sanders and Commissioner Amison. Do we have any discussion? All in favor? Aye. All opposed? That's unanimous.
And Commissioners, the rest of the items on my report are just informational, so unless the board has any specific questions for me, that would conclude my report.
I do have one. Mr. Rowan, I know it's been a long day. I don't know if they're still there, but this is what one of the public comments was for, specifically this subject matter that's informational under here is about the critical shoreline ordinance distance between sewage systems and waters and wetlands that's coming up, consideration to do it. We're going to do it February 21st, 2023. But there was a public comment asking to speak on it.
Could you call the name, please?
Daniel Jackson. The phone number ends in 4418.
Yeah, I don't have a phone. Okay, there are 4 attendees. If any of you are representing or are Daniel Jackson and you'd like to speak on that item, please do so by using the raise hand feature on your smart device.
Nothing, huh?
Once again, we're calling for Daniel Jackson to comment based on the email you sent.
He got tired.
Yep.
You're good. As long as we're good, I just want to make sure we covered them all.
Okay.
Anyone else have anything for Attorney Schuler?
Mr. Chairman, just real quick for the record, I gave you some information earlier about ultralight planes that I've been getting complaints about on Carabel Beach.
Yes, ma'am, you did.
I just wanted to make a note for the record that that's something that we're looking into. Can't promise we're going to do anything about it because it's, how are you going to enforce that? But anyway, I just wanted to let the public know about that. Thank you.
Yes, ma'am.
I have 2 issues.
Go ahead.
One is, Mr. Schuler, is there a way that you can find out what the outcome of the lawsuit with the Alligator Point Fire Department and the gentleman that was suing them for when he failed? I hear that they've reached a settlement. Is there any way that you can find that out and report
If
back?
there are records in the court file I can
Okay.
find out, then I can just call and ask as well. I will do so.
And the other item is, when are we gonna be looking at the contract for the fire department?
Don't, you mean for all of the volunteers?
Well, you remember back in the spring and the summer, that was brought up that we possibly need to do contracts with the Alligator Point Fire Department and the Lanark Fire Department and all that, and I have people asking me the question.
My understanding and recollection, Commissioners, and of course there's a reason why we keep written records, I don't recall being directed to draft any contracts. There's been discussion about potentially with Lanark as part of maybe when they get stood back up, but I don't.
Okay.
I mean, we can check the records and I'll certainly follow whatever directions I have from the board, but I don't have any recollection of being directed to do that.
If you don't mind, go ahead and do that, because there's some people that's wanting to know about the contracts, so for the fire department, and they're saying contracts for fire department.
Yes, ma'am.
So I wasn't a sitting commissioner then, so I don't shoot the messenger, I'm bringing the message.
So are you talking about like memorandums of understanding?
I'll check the minutes and see what direction.
That's what I'm saying, like the contract that would be in existence to say, yes, we're collecting these, basically tax dollars, because it has to do with the fire tax, on your behalf, we'll distribute them to you, and there's a memorandum of understanding between the county and those departments.
Yeah, I understand.
Is that what you're saying?
Also.
Is that what you're saying then? I'm asking, okay.
Oh, yeah, I remember the conversation, I just don't know
That's
that
what
the
I
board's made a
said.
decision.
I understand it too.
Yes, ma'am. Well, I will
Anyone
check the
else?
minutes and report back.
Was that it, Commissioner?
Sure does.
Anyone else have anything for Attorney Schuler? All right, sir. Any commissioner comments?
Mr. Chairman, just real quick, I talked to Aaron about railings at Carabel Beach, so we're gonna try to get those for safety purposes out there. And then I know that we've got the FERDAP grant for Vrooman Park that covers the baseball fields. I know we couldn't get money for the playground equipment, but seeing all that playground equipment at the congratulations in St. George Island, maybe there's a grant or something coming up that we can maybe look at to maybe get new playground equipment at Vrooman Park.
Okay.
Just an option, just a thought. Thank you.
Commissioner, the Vrooman Park is not a beach park facility, so it's not under the 10%
Right.
cap.
And a lot of people don't understand that, but
Yes.
maybe there's another grant that we can maybe get in the future.
Okay.
There
For
is.
that.
Yeah.
There is.
I think so,
I'm sure
because
there is.
all throughout the county, you got different parks that need playground equipment for everybody.
Yeah, yeah, the only reason why we were able to was for the beach park facility spending.
Get it cheaper, get it cheaper.
Yeah.
Right. Mr. Chairman,
Yes.
if I could, I've had a little time to think about the potential lawsuit down at Alligator Point VFD. The last conversation I had, my recollection is I was told they were in like pre-suit or pre-litigation settlement negotiations. So if they've reached a settlement this quickly since I had that last conversation, I doubt there's been any lawsuit filed and settled. So there most likely is not going to be any public information, but I will check and see.
What do they call that when you don't have to disclose what the settlement was?
Confidential settlement negotiations, which is what we'll be doing on January the 27th. Oh, you're welcome.
Okay.
Any other commissioner comments? We got about 22 minutes, and we'll be back at it again with a workshop. I will say, if you're not, if this didn't make you tired enough being here today, or listening to us today, Franklin County is going to take on Bluntstown tonight at the Nest. We're currently in the top 10 in the state, and we've have a record of 12-4. So if you like watching good high school sports, we're going to be in action on the hardwood.
Top 10.
7 o'clock. Meeting adjourned.